channel to contact him. Okay? And after that, we managed to integrate third-party platforms in order to include more specialties to telemedicine. And the last one is that we developed virtual waiting rooms where the customers receive relevant information, or, for example, if the patient needs an initial evaluation, such as body temperature, or, for example, measuring the blood pressure before taking the appointment with the doctor.
Yeah, it's an actual waiting room, but it's a virtual waiting room. Okay, it happens on your screen. So, Internet of Things for medicine. So, Juan, you are the technical guy here.
On Internet of Things, at Intico, we always seek to be at the forefront of the advances technologies of the, So we include the concept IoT of medicine. So IoT stands for Internet of Things, and with that we're able to gather real-time data, then turn that data into information, and that information be displayed at a CRM.
Correct. A CRM that takes the 360-degree approach that we had before. So it shows a dashboard on the agent that is taking the call, for example, for him to address the patient needs. It can show a different dashboard for the executive of the doctor in charge, depending on the stage the patient is right there, right?
So that dashboard is based on indicators, and it is very important to set good and reliable indicators in order to perform a better customer experience, right?
Correct. And this,
so let's check this.
This is almost our final slide, and this is what is next, okay? It is what we call a virtual video bot, and although it looks like a regular Zoom call, those are actually not real people. Those are robots that will be able to help you on a video call if you request it. Some people feel more comfortable talking to somebody that just over the phone, and they can use, or they will be able to use, or robots as virtual assistants, in which the robot is going to be explaining on how to use a device, or how to fill a form, or whatever is requested at that time.
On our quest to improve the customer experience, we believe that a simulated human will give to the patient as a feeling of security or care from their medical provider.
Yeah, and this has been under development for the last few months. We are going to be launching this in the next 30 days. And so it's going to be available, let's say, almost now. Okay, so that was our presentation. Just one clarification: when we talk about collections, we mentioned very quickly collections in one of the slides. We're currently working with a company in Florida that they provide devices for you to monitor your health at home. So depending on the patient request and the doctor's indication, they deliver to your house the device that you need. So in collections and in those type of activities, the regulations are very clear, and we cannot use bots, not even video bots or call bots, to call the patients out of the blue and saying that you need to pay your invoice or here's your device. We need a consent from the patient before that, okay? We know that. We work with the standards of the industry, and we are working now in getting the consent of the patients of that company to move ahead and implement the video and the chat bots, okay? So that's it. I think we are minutes earlier, and we're going to be here 3 days. We have a table in the main ballroom where we having breakfast, and we invite you to come. Many of you had contacted me before on LinkedIn or by email, so we'll be glad to take your questions here if you want to right now. We still have a few minutes. If you have more technical questions, Juan is the guy in charge, and we can have a coffee, and I invite you to come to our booth and have a conversation on how we can be of help for you. Okay, thank you very much.
Thank you.
I don't know if there's any questions here before leaving the stage. Nope.
Yeah. How do you know what you build is actually improving?
How do you know what?
How do you know what you have built is actually improving?
Well, it is based on customers' feedback. It is based on customers' feedback. It is not that we say that we are improving. We are constantly requesting customers or patients, in this case, feedback. And we have done that for many years, especially in the finance industry. And the customers receive quick surveys to give us the feedback if it is better or if it is worse than before. And so about if we are doing it right, that's what you mean? If we're improving ourselves? Yeah.
Every time you make a product, making a product makes better, right?
Not always, but the patients are the ones to qualify, not us.
We don't take like a quantity of an indicator, like a quantity of how much we are improving. We base that on like in quality, qualitative, right? So for example, if you remember at the beginning, I told you that we start with only agenda implementation. After that, we receive feedback from our customers that they need more. That they don't need only just agenda implementation. That's why, I'm sorry. Where is the laser? Here. That's why we move forward to implement an artificial intelligence for omni-channel. So these 4 steps is like we first start with the agenda, then we move forward to omni-channel, then to the third-party platform integration. So all these steps is based on our feedback. So as I said, it's more like a qualitative indicator, right?
There's a government institution in South America that public health centers had an issue with the scheduling the appointments and trying to take care with a regular and traditional call center of the patient's demands. So we improved that in about 300%, the ability to contact the customer's base or the patient's base. And it was a huge improvement, and it was based on real statistics. I mean, they were not able simply to address all the demands. People coming back and forth, and so the contact centers are usually overwhelmed with that. So bots are precisely developed for that reason. Okay, they can manage hundreds of calls simultaneously.
Yeah, we have another question here.
Yeah, I think. Yes.
Your co-payments are deductible. Your platform, does it collect it from the patients or collect it from CMS, like Medicare, Medicaid, and private insurance?
It's both. And it is not that we have a solution that you have to adapt to. It is the opposite. Our solution adapts to what you currently have and improves what you have. So we adapt to the system that your institution is currently using and propose improvements. But we don't have a package that we send you. It's actually the opposite. We adapt to what you have and use AI for that. Okay? I think we have one last question. No, you're welcome.
On the initial intake call between the bot and the healthcare provider, can you give us some deeper insight on how that was executed as far as performance, time, standards, et cetera? How does the healthcare provider know that this is coming through the bot? The patient is already waiting to receive more information. What's the timing of that? So what's that blending between the bot and the healthcare provider as far as that virtual call, real call?
It's all integrated in the current systems that the healthcare has already. So most of the institutions already, they have their own contact centers. So we integrate with that contact center. So we use the live agents that are trained. The live agents are live agents of that contact, or your contact center, let's say. So we train them, and they interact with the bot.
Yeah, that's my question. What's the alert for the provider to understand that this call is coming through this?
Oh, they know. They have a screen. They know what is happening. Yes, they know exactly what is happening. And there is a call in the waiting list, and there is coming, and there is a bot.
So there's a way to differentiate for that provider, right?
Yeah.
On that call center to know
Yes.
it's coming through the bot versus just a call coming
Yes.
from the patient outside of your solution.
The important thing there is that for the patient, it is seamless.
That's my question.
Yeah, no, for the patient doesn't notice that. Okay, so thank you again. We wait for you on the table. We're going to be there today and tomorrow. Well, 3 days actually. So thank you very much.
Thank you.
All right, fellas, thank you so much. That was indeed very, very interesting. Just a few quick notes for the rest of the day and the next 2 days as well. If you have a question to ask during or at the end of the speeches and whatever, please use this mic right here. That's why we have it set up there for you. That way, everybody can hear what you have to ask, and we can all, kind of, participate in that as well. So, also, don't forget to turn to your neighbor during these breaks and whatnot, and make sure you guys get your LinkedIn, profiles and become friends so you can connect well after this. And you can always hashtag any pictures and any of that sort of thing on your social media with Health2Conf. That's Health2CONF for that on your LinkedIn and Facebook and whatnot. We'd love to see what a great time you guys are having here. All right. Moving on. The next session looks at how digital health has the potential to revolutionize in-home care and improve the quality of life of the nation's senior population. Please welcome on stage Alex Yardigan. He is the founder and CEO of Karen Does. He will be speaking on the topic Digital Care at Home, the new frontier in senior care and concierge managed care as well. Please put your hands together for Alex.
Thank you. Hi, wow, what a vibrant gathering today. Is this it is wireless, okay. Okay, hi, good morning, Las Vegas. This is particularly exciting, an international conference on health, and you'll see me focus more on the United States, because that's where home is where the heart's at. But with that said, I wanted to share with you some very important revelations that are literally, very important revelations. But first, before I do that, I'm going to okay, there it is. Great. So I'm here to declare dawn of a new era. And why? Because I've seen hundreds and thousands of patients from different walks of life. I've seen patients who, on Skid Row in Los Angeles, homeless for 10 plus years. I've seen folks who were homeless for 10 minutes. Seniors are particularly interesting simply because when I was managing 28 clinics across California and Texas, delivering primary care, mental health, substance abuse treatment services to over 100,000 patients that were largely lower socioeconomic populations. I saw the struggle in these eyes and the brightness behind them once we were able to actually provide them with even a little bit of access to care. I went to Cardinal Health, a Navi Health organization at the time, and I was able to work with Dignity and HCA hospitals, 14 of them in Southern California, to administer the bundle payment program in Medicare. And essentially, I was responsible for over 50 skilled nursing facilities and how they performed once they discharge a patient to the home, or to the skilled nursing facility, or to home health with home. And that was a very interesting exercise, to say the least. You know, we made several millions in one market, lost several in another market. That's when Humana heard of me and recruited me to oversee network and contracting for the west side of this country. And when I went to the health plan side, you guys, I saw levers of opportunity that providers typically don't see. And so throughout this session, I want this to be a not-so-session-y session. I want you to ask questions. If something excites you, jump in. Or if you have a solution that you're having trouble with bringing to market, jump in. Why? Because when I left Humana, I started Care Nodes. Care Nodes essentially, has really developed into a managed service organization, a digital health MSO. Right now, we cover about 51 million Americans. We have 10 medical groups under management. We provide Alzheimer's care, post-acute care, homeless care. We provide a number of different elements of care that nowadays are being pushed to home, hospital at home. And the concern that I was having was that, while all the care is being pushed at home, how about those that don't have homes? And how about the rapidly aging population that was next stat? 1 in 5, I honestly think it's a little bit more, I think it's 1 in 4, but the stat that I could find in the most solid way, 1 in 5 Americans are going to be 65 plus. There are going to be more 65 plus than 18-year-olds by 2030. And that means, no matter what I do, I don't think I'm exempt from aging into 65 and over. And so I'm personally concerned about the availability of healthcare when I might need it at that age. I don't know if you've ever felt super sick and kind of helpless and thought to yourself, my God, good thing I'm not 80-something, then what would I do in this condition? At least I know I could get better quickly. It's at the most vulnerable times of our current fully able existence that we need to think about when we might need care at our more vulnerable times. So if the industry is to follow anything, it's to follow these trends that are just starting to kind of stimulate the discussion between payers, providers, digital health organizations. And we've been very successful at Care Nodes with our ecosystem, getting health insurance contracts to be reimbursed for services that are traditionally not considered reimbursable. For example, food. For example, socks that monitor diabetic foot ulcers and alert us in an event that there might be an exacerbation so that we can save valuable feet. And I want you to think about these seniors at home. Quite a bit of them are alone. How are we monitoring them? I mean, all these cute RPMs and CCM, right? So remote patient monitoring, chronic care management, all these remote care modalities, are they really user-friendly? Because when I look at my iPhone, and my grandma has a slightly larger iPhone, she has a really hard time managing that device. I have a hard time managing that device sometimes. And to expect our seniors to utilize the devices that Silicon Valley or these great engineering folks know how to develop, for them to utilize products that are created by 25-year-olds, so to speak, there's a fundamental disconnect between the producer or the supplier of service and the recipient. And that issue has been exacerbated by our third-party payer system because the patient ultimately isn't the one who's buying, right? Ultimately, it's the health insurance that's paying. So all the marketing, all the strategy is targeted towards the health insurance companies. But with something like ambient assisted living, when you have sensors at the door, for example, of grandma's bedroom, And we know that if grandma doesn't get up and walk out of that door one way or another within, I don't know, 16-hour period, then we might want to know about that. So ambient assisted living these are features that are embedded into the existing home of the senior citizen or the patient, and they passively monitor activities that might be that might otherwise indicate an issue, right? So if grandma isn't getting up, and all you have as a solution is a mat by her, because there's a solution that is it's like a mat by the bedside, and so if the patient steps on it, it'll quickly try to read a temperature or a weight measure or something. But I mean, people slip, right? Those mats are not always there. I had a patient with dementia who used to like to really reorganize her home all the time. It was so sweet. She would do such a great job. But she's reorganizing the care infrastructure that's been put in place. And our nurses were going, they're really anxious because there was a lot of, escalations coming from that unit. Smart wardrobe addresses some of that issues. So smart wardrobes, these are socks, specifically siren socks. Siren socks invented by a woman in the United States, USA made. And essentially you wear these socks. They have sensors woven into the thread of the socks. And they're so comfortable that these patients wear them on average 12 hours a day. Even Florida patients, 12 hours a day wearing socks on average. 91% of amputations avoided. Why? Because we know the ulcer is forming even before the patient does. And so the 24-hour care team reaches out, intervenes, and they save legs. So no matter how much, I should have thought of a pseudonym. Jane, our favorite patient who likes to reorganize a lot of things, she was wearing her socks. So she's walking around, getting her activity in, reorganizing, and we're able to cross-reference the signals that are coming from that unit so that the patient isn't getting calls from this coordinator and that coordinator and another coordinator. So kind of coordinating the coordinators and taking the human touch points out of the monitoring as much as possible and embedding the humans for verification and validation is how we're able to scale the workforce of the future to care for the population of the future. And when I say future, literally I mean like tomorrow, right? Because this has been going on since 2010. The demographics have shifted to such a rate that 10,000 Americans a day are aging into Medicare. That started 2010 through 2030. But how about those that don't have homes and cannot have fancy sensors embedded in the frames and don't have the luxury to reorganize the mat from one place to another and make our care coordinators nervous? Those without homes, do they not deserve care at home? Because care at home is really a concept, right? Yeah, it's a setting, but it's a concept. It's a concept of, okay, age in place, age in grace, stay comfortable. And when major buyers like Humanas and the Uniteds and the Aetnas and you name them send signals, yes, care at home, then the industry rushes towards responding to those signals to the detriment of those that don't fit the criteria of having a home. So I worked with, I was a co-founder of a nonprofit called Cardboard Origami. 10 years ago, we started this organization providing portable temporary shelters to those who've been displaced either due to natural disasters or poverty, using the art of origami via a cardboard material set to open and close this unit in less than a minute. And it's waterproof, it's insulated, it's highly portable, and it's part of a program to streamline folks into permanent housing. So no, it's not just, patented sexy shelters we're handing out to make things a little bit more comfortable on the street, but it's part of a program to streamline folks into permanent housing, and these units are used on private grounds. It's step one. Step two is your care navigator, care coordinator, whatever you want to call them. We call them housing navigators. 3 is placement into permanent housing, and 4 is employment. to sustain that newly housed status. It's not simply enough to, here's your caseworker, Godspeed. But here's your caseworker, Godspeed, here's, employment resources, here's, making sure that we provide the wardrobe for them to be able to stay employed. It's not just enough for one interview. And we've been able to successfully house and employ 5 out of 6 participants for 3+ years using this approach. So homelessness is really a chronic condition for some, and it should be treated as such. And it should be looked at as a health issue. Versus what we do right now is a moral failing is how we look at it and we try to ignore. I do. When I'm in LA, when I exit the freeway, I'm just overwhelmed by the off-ramp. So yeah, I'll look around. I'll try to ignore. In my head, I'll be like, am I helping in other ways? But it makes us feel bad. And so we should leverage our human emotions and our affect to channel them into solutions that will generate revenues for us and also positive social net impact. Cognitive health is something that is a major discussion point right now, but yet little to no solutions are available. It's entirely complex. And for every 10 new telehealth company I see, I've seen maybe one dementia-related organization. I'm hoping I'll see more than one by the folks that are in attendance today. They'll say, I'm working on this. But we talk a lot about mental health, right? Nowadays, mental health. But mental health and cognitive health are very, very closely related, right? So when you have depression, you can't sleep well, or a number of reasons. I'm just giving you one anecdotal, vignette. Then you start to form these plaques. I'm not a doctor, but they tell me. You start to form these plaques. Your depression leads to habits that are not exactly great for your cognition and your cognitive health. And so when we have all these seniors aging to the rate that we just talked about, and you have fewer 18-year-olds than you have 65-plus-year-olds, cognitive health, we're assuming that everything will be intact. That's our working assumption. We're not thinking about the workforce that needs to take care of these folks, including probably myself, due to family history. Is anybody working on workforce supply here? Anybody working on workforce supply? I see the hands are going up very, very, very slowly. So as you could tell, there's a huge issue. So Care Nodes, we have a network of 134 healthcare providers. National network, multi-licensed, multi-specialty. And what we do is we allow health systems and largely startups to access our network of providers, just kind of like a health plan model a health plan network access model would be. What this has done is allows us to enable access. The medical groups are able to kind of rent our provider network. You know what you're talking. She knows what's up in this industry. Able to rent the provider network and scale this supply up and down on a monthly basis so that they're not stuck with a huge payroll suddenly and they can't get patients or they don't have enough work for their providers to do. So we actually now provide for 10 medical groups a full network. So while those medical groups are paying us less than what we're paying our providers, we're able to pool these resources together and enable broader access, broader coordination, all these things we always hear about, but we don't hear the how. We just hear the what. Connectedness, this is not about the internet, although a segment of it is, because there's a lot of folks in this country, in the United States of America, that do not have the kind of broadband, the kind of reliable internet that most folks that have these are used to. Internet is not a utility, it's not a public utility technically. There are folks that do not have access. So when COVID hit, I was the COO as a service of a behavioral health organization. We had about 100 patients a day, 7 days a week, outpatient, fully commercial group. When COVID hit, first commercial took a huge dive, different conversation. But the staff were really just used to coming in, clocking out. Didn't know that some of these folks didn't even have internet at home, our own staff. So within 3 days, I had to arrange hotspots and, an infrastructure to deploy. So when we're thinking about access to internet, if folks that might not even really have access to those services. But connectedness is really about social connectedness. How could we live in a better, happier world if we ourselves are not happy or not, quote, better? This is the concept of human revolution. By having a revolution, so to speak, internally, by growing internally, by overcoming our own challenges internally, then by extension, we make a change externally. We impact those around us, those in the most immediate concentric circles. And when we think about the problems we're trying to solve, or a business idea, or another healthcare conference, how are we developing as leaders to actually address these issues? Because what's on the slide here is really just these bullet points. But as leaders, we will naturally come up with the solutions that will address our country's problems. So as long as we are committed to self-development and growth in the meantime, and that's how the best of ideas have come to fruition, via self-growth and development. And so the premise is that we cannot be expecting a happy world and a cost-effective world, depending on what conference you're in, they have their own world that they idealize. We cannot get there without self-reformation, to whatever that means to you. And I want to actually, let me see if there's anything on here. Okay, so this is, the biopsychosocial model is what, when you kind of saw the last slide, you could kind of tell the biology, the psychology, and the sociology, so to speak, the society in which, or the social determinants of health from which that individual comes from. This is our approach. So any kind of network model, any kind of business model, any kind of health plan contracting, any kind of business deals we do, we look at this first. Where does your solution fall within the biopsychosocial spectrum? And how can we enable the go-to-market for a given healthcare startup based on their clinical and operational model? So we can have a resilient future. This is our future. Our seniors are happy and resilient because our workforce is happy and resilient, because we approach communities as needing resilience and not just a drop of, aid. Or here's another product, and then, the company's sold and they disappear. Let me see. Let me ask you a couple questions here. You, sir, what's your name? Nick. Nick, what do you do?
He has a few businesses. One of them is healthcare consulting.
Excellent. Excellent, thank you. Nick is a healthcare consultant, also is an entrepreneur doing many things. Ma'am, what's your name? Monique. Monique, what do you do? Marketing. Monique is a great marketer. I could tell she's up here in front taking copious notes. Because, Monique, what is one of the greatest challenges you see in healthcare today, in the work that you do, or in your everyday life? She says it's hard, because there's so many challenges. She's wondering if she only should say one. Sorry, what's your name, ma'am? Natalia, how are you? Great, what do you do? Excellent. Former clinician. Well, always a clinician, always a clinician, but she doesn't provide clinical services anymore. But I could tell you're really resonating with this issue. So what we do as Care Nodes is we work with healthcare technology startups that that come from not necessarily a healthcare background and want to do business in healthcare. And we help accelerate these startups into market by providing them with a medical director, should they need that. In some states, you need a clinical person. In Florida, I can own a clinic. In California, not so. I need to have a physician or a licensed person that'll be owner of a clinic. We then provide health insurance contracting. Why? Because direct-to-consumer models, while very popular, are not very accessible for a number of reasons, including costs. So when I'm already paying my insurance premiums, my expectation as a consumer is to have access to my provider network. Often that's not the case. That's not the case, right? So for example, if you want to find a mental health provider, you might be calling around, they're not taking your insurance, provider might have expired quite some time and they're still on the directories, a number of issues. So as a mental health patient, I'm getting worse. I am. I'm not being able to get in touch with anybody. So we get the insurance contract set, network management set, so that our digital health organizations are able to take health insurance and able to charge copay as opposed to a full cash price, where either they lose money, they meaning the digital health company will lose money using a Uber approach. Okay, yeah, give a great discount, 3 years, and then take up the rates. Or the patient's out of money, like I probably shouldn't name them. Like X organization that charges $400 a week for texting your therapist. Not accessible, right? Not accessible. So we get health insurance contracts to make these services accessible. And then we provide our digital health organizations with that provider network I was telling you about, so they don't have to go worrying about, okay, what therapist should they recruit? Is this therapist an axe murderer in Arizona, but great in California, right, with this multi-state licensure? You have to be able to track sanctions all the time. So I know I kind of skipped over what we do at Care Notes because this isn't the Care Notes discussion. This is really a concern that I have for our country. And the intention here is to spur innovation. We're very open about sharing how we do things. The why is kind of obvious, but happy to share the why we do things. Because it's better for 1,000 organizations to take one step forward than one organization trying to take 1,000 steps forward. So with that, we have 10 minutes, according to this timer. And for the last 5, I've said, let's talk, and I guess it's just me talking. So I want to open up for questions. My expertise include managed care, health insurance contracting, digital health, and so on. So, yes, sir. Can I offer you this microphone? Just so we can hear you nice and clearly. Thank you. Hi.
Name is Ali Kazaizadeh. I'm a primary care physician. Thanks for your talk. That was interesting. What's the percentage of the service that you provide are telemedicine right now?
Good question. 99%.
Right. And do you have to go inside the people's home and see them as well? Or you do that type of service?
That's a great question, doctor. So we have the ability to go in the home if need be, but that's not our primary modality of our service delivery, simply because there are some areas that's very difficult to get to. So what we're looking for is partners, right, different parts of the country, where we can contract with, and if they have a mobile unit or somehow, capability to go to, some, for example, Nye County right here in Nevada, right, Prompt, Nevada, which you have one long 90-mile road that connects all things else. Then I'm more than happy to contract and expand our ability so that we can go in the home as soon as we can.
How many states do you guys
We're in 50 states.
Nice.
And DC.
Okay. Let's talk after this.
Let's talk.
Okay.
Thanks, doctor. I appreciate it. Yes.
I was wondering about your concierge service, whether it can be extended to patient compliance.
Excellent question.
And the other question is liability. Who takes the liability in those cases where you introduce intelligent techniques for detecting behavior and so on?
Good question. So the last question was, who takes the risk? Who gets sued for artificial intelligence or these, technology-based? I'm very passionate about that. Good question. And your first question, just so I could repeat?
The first question is about patient compliance,
Patient.
whether we can introduce a concierge for that.
Sure. Yeah. So thank you for that. So there is this element of concierge care, and that was in the title of this speech or this session. Concierge care in managed care, right, concierge care that's paid for by health insurance, is really a movement around, okay, well, not everybody goes through the same utilization management process. You know, not everybody's indicators are so cookie cutter, right? So as healthcare providers, what we do is we take the risk from the health insurance company, right? We take the financial risk, and then we divvy up that, the dollars based on the patient's risk and what needs they might have, and then we kind of curate. So the patient compliance should not actually be a concierge element, should be standard across the board, right? So measuring the patient's compliance, let's say with medication or treatment plan. Is that medication or treatment plan? That should be a standard element. It should not be a concierge element. Now, if a patient has particularly, a hard time being compliant, and you find out by, I don't know, maybe you have pill bottles that are, kind of smart, and they could tell if the patient's taking the medication, or you have access to pharmacy claims to see if the patient refilled their medication. Those are some indicators of adherence or of patient compliance, and that's not a concierge element. That's a standard, across the board element. Now, concierge element would be if that patient has, a tendency to overuse medication, and then kind of as a concierge component, want to introduce maybe a substance or behavioral support element where not all patients would need, right? So does that answer your first question? So it shouldn't be concierge. Patient adherence should not be a concierge element, should be standard element.
Yeah, it's more about introducing the same techniques that you use for concierge. Like, for example, monitoring the patient at home, right? His movement, his behavior, what he's doing, his mental status, and from there relating to the patient compliance with the medication.
Well, why don't we talk after this then?
Oh, sure.
Because that's interesting link that I'd like to draw kind of separately, because I want to be able to get to others. But let me answer your question about risk.
Okay.
Never should technology be created just for the sake of technology in healthcare, right? Technology should be created for the sake of a functionality in healthcare, for a need. And so I think that's like a lawyer, I should refer that to like legal technically, especially since we're on camera. But the practice of, underwriting malpractice insurance when technology is involved is complex and requires negotiations. And why don't I talk to you about that after too, just so they don't pull this video up and say, well, you said, but let's talk after the fact,
Sure. No
if
problem.
possible. Thank you. These are great questions. Yes.
Hello, hi, I'm
Hi.
Todd.
Hi,
I'm
Todd.
at the National Institute on Aging within the NIH.
Excellent.
And I manage a program where we provide over $100 million in funding to startups, developing age tech and other solutions. So one of my struggles, we probably fund over 50 startups right now developing digital care at home technologies.
Sure.
And one of my struggles is they're so, compartmentalized. And how can we as an industry kind of push these different startup companies to come together so you're not having care coordination completely separately from care navigation, as an example?
Can I take a seat for this? Because the NIH just posed a question. How do we aggregate all these startups towards a unified action, many embody, one in mind? Yeah, no, that's a great question. I think the part of what we're doing at Care Notes is just that. We can talk later. No, we will be talking later. But the country deserves this answer now. It's a tough challenge because the folks that are generating these technologies don't come from healthcare backgrounds, which is natural. I mean, I come from the halls of Humana and clinics and hospitals and skilled nursing. When I started this company, I was trying to do one website. I needed to go to the tech people. They come to us. Ultimately, it comes down to an approach from the top line payers, and as long as they are carving out payments for behavioral and physical via two health insurance companies, you by definition don't have integration. I think your question is tied to integration. I appreciate you for not using the word integration because it's lost its entire meaning in this industry. However, it is the integration of operations with clinical workflows and some standardization from NCQA as to what are the standards for hospital at home, what are the qualities, what are the accreditation standards for bringing any kind of technology to people's homes where you don't have other clinicians or other staff looking at this machine or this thing saying, well, this is acting abnormally. The patient just has that one device or that one product. I definitely want to talk after this. So that we can have a unified approach in innovation. Thank you for standing for such a long time. What's your name?
Actually, in keeping with the last two speakers' questions, I was
Sure.
kind of curious about how, in a concierge space specifically, you might be addressing the kind of trend towards naturopathic medicine and alternative care, for example, like chiropractic care in the current COVID environment where people are, especially seniors, the elderly, are potentially less interested in going out, and there's the whole fear element. How can we deliver those? Is there something in your service that can help deliver those alternative services that people might feel have a value-added effect on their health care, that we can maybe bring those services into the home also?
Yes and no. What a great question. Yes, in the sense where we work with organizations that provide doula networks, doula care, right? So that's your non-traditional kind of, maternity care team member. When I say non-traditional, every time I say non-traditional is what the health plans have not traditionally been paying for, because that's what drives service availability. If you're not going to get paid for it, you don't know how to generate revenues from it. As a business person, right, there isn't much of a business case. Now, Chiro, there's a huge movement on the Chiro side I'm very well connected with. Chiro, as a non-medication assisted treatment for opioid use, has been demonstrated time and time again in journals. Yet we still keep seeing medication-assisted treatment, which we should. Treatment options should be available and should be diverse. But chiropractic care, for example, is a very effective, I'm not a doctor, but look it up. It's a very effective form of opioid treatment, opioid use treatment. Now, how to bring these folks into people's homes is the reason I'm here, right? To generate and stimulate this discussion so that we can find ways to really scale this kind of infrastructure. As things are becoming more and more expensive, the prospect of sending someone to someone's home, the first thing you think about are gas prices. And so how will health insurance pay for the gas is the question in the boardroom, right? So is there anything you're doing in this? You don't have to come all the way here, just send me signals. Anything, unless you want to. It's good for your steps. Helpful Hemp CBD company. Uh-huh. That's excellent. So natural medicine. Now, the thing is, we're in the West, and there's automatic resistance, even towards people who are the most open-minded people, let's just say, in these boardrooms. I'll be signing the deals you need to scale this in an enterprise way, and they're thinking they're thinking home-based, they're thinking potions and pills. It really comes with education first. What does it mean? What are you treating? And what is your care pathway, right? So if it's this disease, what set of standardized operational and clinical protocol do you have to administer your treatment or your regimen? So there's definitely a pathway. And nowadays with, the cash concierge, medical concierge, services that are about $20K a year. Some have that kind of money. Perhaps there's some opportunity to, collaborate with those kinds of organizations. But outside of that, there's a long way to go for non-pharma products in people's homes paid for by health insurance. And that's my main thing. How do we get you paid by health insurance? Because people are paying health insurance, you're paying your own premiums, and then you're providing the service. So our business model at CareNotes is really around leveraging health insurance money to then drive multi-directional value in the market. Those are great questions. So let me see. In your experience as a clinician, she's like, me again? She's like, me. In your experience as a clinician, what is the most difficult, what is the challenge that you've encountered, even in your everyday life? And you're free to also opine. All of you, oh, how wonderful. Opine. Oh, you're all clinicians. Okay. I'm going to have you. Can you repeat that?
Yeah, all three of us are clinicians. We're all private pay because the insurance companies don't reimburse, or when they do, it's usually a struggle or refused. There are so many aspects of working with companies that it doesn't work. I do a lot of concierge medicine. I have an internal medicine doctor that works with me, psychiatrist that works with me, practice, behaviorist, therapist. We go into homes, we stay in the clinic, we do a lot of teletherapy, and we have moved away. I tried health insurance for a while. I worked with some unnamed companies through health insurance, and it took 1.5 years to get paid, even 3/4 of the percent that we were owed, and so we dropped it. We said, we're moving away, and we have found that because of health insurance companies and the way they structure things, clients are much more willing to pay us first and seek a reimbursement than going after a clinician who works with a health insurance company.
Sure. Thank you. This is exactly pointy case. You have providers leaving the system that you by law are required to pay for, health insurance, leaving the system so you have less supply, yet you have to pay now many more people. And I'm not talking about your subscription services. I'm talking about I'm not talking about your streaming subscription, sir. I'm talking about your subscription to your doctor. So you have your health insurance premium, you have your physician subscription, you have your Netflix, Hulu, HBO, Prime, Paramount. So is this really where you want to be headed? So as a senior person, like let's imagine me, you know, at my 85, and I'm trying to access care. I might not have the wherewithal. I don't know what technology is going to be like then. To find this excellent clinician, this group of clinicians, to subscribe to them, to then have the financial means. My SSI check's $116.13. How am I going to afford my unnamed health plan premium? Some in this market, senior premium, in this market, $350 for MAP, Medicare Advantage PPO. And yet the physician doesn't get paid. So this is a systemic issue that will not be solved in the next 3 minutes and 43 seconds. However, we've made a tremendous headway here by talking about the issues in a way that's not so flowery all the time, right? We're doing integrations, we're doing, Health 3.4, health this and that. No, but ultimately the problems of Health 1.0 are still here, which is the physician who you depend on for getting care is not getting paid. And so, they're in this business because they're to do no harm, right? They're here, most clinicians, not just physicians, clinicians I work with are in it because their heart's in the right place. They have some personal story. They have a reason. They've spent all this money to go to school, but they have not been trained on the aspects of business of healthcare because they're clinicians, right? It's not part of the curriculum. Yet they're thrown in a world where they have to fend for themselves to figure out if this contract makes any sense. For all they know, it may, because they only have that one contract as their sample to compare. When I went to Humana, I had 3,000 plus contracts that I compared. And when I saw the opportunity to do a better America, because the money is there, but it's not getting there. It's not getting to the clinician who needs to get paid. So I have a time for one more question. It looks like there's a minute left on this timer. Actually, why don't we talk after you and I? Because what I want to do is I want to open this dawn of a new era and encourage everyone in attendance here to take one step forward towards a future where when we need the care at that, not that we don't need care right now, I need care right now, literally. But when we're a little bit older, when we age a little bit more, our resources, our ability to, be agile, to be able to go and seek what we need diminishes even more. And so thank you everybody for being here today. I'm a resource to you. Our company website is carenodes.com. I'm on LinkedIn. I'll stay around to be connected. Because again, ultimately, my organization is not funded by any venture, anything like that. We're fully self-sustained, bootstrap, positive cash flow organization. And we like this position because we get to answer to our patients, to our providers, to our colleagues, as opposed to any fund. So let's work together, you guys, literally, to make this place a better place for when I might need that care at that age, or you or your loved ones. Thanks.
All right, ladies and gentlemen, now it's time for our awards and recognition program. The Health 2.0 Conference's Outstanding Leadership Award and its Best Companies Award celebrate the incredible initiatives of visionaries in the healthcare, pharma, and wellness sectors. Today, we will be honoring a few leading organizations and individuals for their innovations for helping to improve the quality of patient care in their respective programs. To present the awards, I have with us Ms. Jody Ruttenberg. She is the Vice President of E-Commerce for Birmingham and Bargains. As you hear your name, please enter on this side of the stage and exit the same side as well. I always think I'll never need these, but I always end up needing them. All right, to kick things off, CCPHP.
Thank you, and good morning or good afternoon. I'm from the East Coast. This is just such an honor to be here, and I'm representing my small and mighty excellent company and my team together. And our CEO, unfortunately, wasn't able to be here today, but in general, I just wanted to say thank you very much. It's our first time at Health 2.0, and again, such an honor.
Wonderful. Congratulations.
Thank you.
Continuity Health Solutions.
I'm glad to be present with so many thought leaders today. This really doesn't go out to me; it goes out to my team. No one, you can't be a leader of one, so we're all built off of our team members. So this really is their acknowledgement. Thank you.
Cornerstone Healing Center. Demur UV.
Hi, everybody. This is really awesome. Recognition like this means a lot. My dad and I started our company in the basement, and we set out to disinfect airplanes before anybody really cared about that. So, you know, it's been a long ride and a lot of years of hard work, and really appreciate this. And thank you for the honor.
Guide to Self. Healthcare Solutions Center, LLC.
Thank you very much. This is an honor to be here, and also goes out to my team. We could not have done it through COVID without all of our nurses. Thank you.
Sure words.
MetaPocket.
Thank you, everyone, and what a great start for the day one. Such awards are a great recognition of the work, and I think it's a boost for right vision and vision that a company has. And we are into a little new space of making the care borderless. So we are cross-border care, and I would love to talk to more thought leaders in this house today, and maybe in the next 2 days to collaborate. Thank you.
MetaLife Diagnostics Laboratories, Inc. Inc.
Thank you, everybody, for being here. This really lends credence to getting an award like this. The most important thing I want to say, though, is I have a team back behind me that you don't see, and they're the ones that have made tracking nutrition a breeze. So thank you very much.
Congratulations.
The ETG companies.
Thank you very much for this excellent recognition. You'll find ETG technologies in things from hearing aids to ORs, to medical devices, genetic labs, and so forth, even though you've never heard of us before. I want to thank decades of researchers and engineers and other team members who have made this award possible. Thank you very much.
Yin Yang Wellness Center, LLC.
This is a great honor for both of us. We're glad to be here, and we have a mental health wellness center in the South, Mobile, Alabama, so roll tide.
Babita Spinelli.
I am so honored to receive this award, and the reason is because I transitioned from corporate America, working on Wall Street, to mental health and wellness, because I felt so passionate about being able to elevate mental wellness for individuals and organizations. So I believe that this award really goes to, and I'm here because it goes to those individuals that let me into their lives, honor me with their stories, care about their mental well-being, and for those corporations and organizations that care about the mental well-being of their employees. So really, this award is because of them. Thank you.
Bruce Likorowick. Chris O'Brien.
Good morning, everyone. It's a great honor to be here with you today and to be selected for this award by such an amazing group of thought leaders and innovators. The healthcare system today can be terribly fragmented and so confusing for patients. The different actors in the system are not connected to each other, and I think we're all hearing about the amazing digital innovations that are working to change that. So many patients are left to go on their journeys alone, lonely, and disconnected from the healthcare system and each other. At AdhereTech, we're changing that in a small way through the connected pill bottles and other devices that keep patients connected to care in real time so they can get care when they need it and stay on the amazing medications that they've been prescribed. Thank you all so much for having me here, and I look forward to speaking with you afterwards.
Joe Avellino.
Good morning, everyone. Congratulations to all the winners. It's an honor to receive this award. It's my 8th year as a CEO at College Medical Center. We're a 221 acute care bed hospital specializing in behavioral health services and almost 500 admissions a month, including detox, approximately about 100 admissions a month. But this award not only goes for myself, but also to my over 1,200 employees and 200 physicians and my medical staff to making it happen. Thank you, everyone, and have an amazing day.
Kevin McRitchie. Linda Savlin.
Hi, I'm Dr. Linda Salvin, and I'm honored to receive this as I'm a sole practitioner. 45 years ago, I got my master's in public health and epidemiology, was in a plane crash in '81 after grad school, became very psychic, spiritual, went way to the other side in paranormal, have been helping people. Then I switched again and got into metaphysics as a clinical person. And this brings home 45 years of work and struggle and growth, and thank you so much for all of it. Thank you.
Mark Edwards. Meni Edami. Ryan Castle.
My name is Ryan, and my business tends to be connecting organizations with multidisciplinary research, which is just a lot of words of saying that I don't usually get up on stage in front of people. When one of our own private research projects took off and went viral and got around 8 million reads and started cropping up in journals and institutions, honestly, for a scientist, that's just a dream come true, and I'm unbelievably grateful to my team, to the opportunity to be here, and more than anything else, I'm grateful for all the good that I really think is going to come out of a gathering of minds like this over this week. Thank you very much.
Sahar Ashad.
Thank you so much, Health 2.0. I'm the co-founder and chief operating officer of a company called CloudMedX in Palo Alto, California. And we provide a health data platform to provide aggregation, automation, and AI, all in one platform. Thank you so much for this award. It means a lot. And I would like to thank my team back in California. Thank you so much.
All right, one last round of applause to all of our honorary awardees this morning. And my lovely co-host, Jody Ruddenberg. Thank you, Jody. All right. We're positive that we will continue to hear about many achievements and ambitious projects in the coming months from all those folks. And right now, I suggest a quick coffee break, a little caffeine injection perhaps. We'll meet back here in 30 minutes. And while you're out networking with your colleagues and LinkedIn, our hashtag is Health2Conf, Health2CONF. Thank you very much. Everybody get your coffee and get all caffeinated up and everything for the post-morning sessions or the mid-morning sessions? Good, yes. Gotta love coffee. Can't imagine going any amount of time without it, unless, of course, I'm sleeping, but that's a whole other story. We are going to continue on right now with the post-coffee sessions of the Health 2.0 conference, brought to you by our silver sponsors, MOFI and Inico USA. We are absolutely delighted to have such amazing supporters. And now we also have an interesting panel discussion for you, where a group of industry experts will present their ideas on the subject, impact of social media and its repercussions on mental health. Spending more than 3 hours on social media per day puts adolescents actually at a higher risk for mental health problems. What can we do to limit the negative consequences of social media use? This is one of the many questions that the panelists will address in this session. Please welcome the session moderator, Natanya Watchell. She is the founder of the New Solutions Network and the CMO and Chief Community Officer at Evermore. She will be joining us on stage right away. Also, before we start, I have badges here for Sutessa Anthony and Linton Kareen. Sutessa Anthony and Linton Kareen. This young lady here over on the side, raising her hand, will have those for you. If you want to see her, she will get you taken care of. Stage is all yours.
Thank you. Hi there. Wait, this is height impairment. One moment. So I'm just going to introduce my esteemed colleagues here. First up is Dr. Jeff Nugent. He is a licensed marriage family therapist in 5 states, and I think going for more. A professional clinical counselor, and he focuses on adolescents and adults dealing with depression, anxiety, addiction, social media, video games, self-esteem, relationships, and behavioral issues. His dissertation focused on adolescent and effects of video games on the quality of life, resilience, and motivation to play. His work for nonprofits was on a mobile crisis team with suicide assessments and family support for children with mental health disorders. He was also a supervisor of behavior and mental health for school districts, creating mental health programs for general education. What else? A lot of things. He's founder of the CEO of Nugent Family Counseling Center, and his private pay company located in several cities, San Jose, Santa Clara, Los Gatos, California, and Reno, Nevada. They help families with wide areas of support. I don't know if there's anything you'd like to add, because that's quite an impressive, truncated biography of Dr. Nugent. So, welcome. Okay, next on the hit list is Babita. So Babita is an award-winning, internationally recognized psychotherapist, executive coach, mental health consultant, and relationship expert. She focuses on helping people optimize their relationships and thrive in all facets of their lives. She's formerly a lawyer and Wall Street executive, and brings a unique perspective in that to manage mental health issues and relationships in the workplace. Develops business strategies relating to human dynamics and resolves high conflict issues. In her private practice and public engagements, she empowers people and organizations to examine and redefine relationships as a tool for personal and professional growth. Babita is a sought-after expert in media across the globe. She's been featured on media outlets such as Forbes, Bloomberg, ABC, NBC, CNN, Men's Health, Business Insider, MSN, Elle, Huffington Post, Washington Post, South by Southwest, and many, many more that I can't fit on this iPad. She is a recipient of the New York Psychotherapist Award, and obviously she just received a Health 2.0 Leadership Award, and has really showed us all how we can focus externally and make this world a better place. So welcome, Babita. Next, we have Carrie Karki, our resident expert on all things marketing. She is the founder and president of White Box Marketing. It's a full-service marketing and advertising agency in servicing, businesses of all sizes. She's been doing this for over 20 years, and they include strategic planning for long-term client partnerships, and they have an award-winning team of creatives that support her. Carrie is an active member of her Central Minnesota community, including multiple leadership groups, personally and professionally. She's very philanthropic, and she's an advocate for unity, embracing all of our different backgrounds, locally and globally. Welcome, Carrie. Okay. Oh, I was going to call you Dr. Priya because I have a friend Priya, but I don't know if you go by that for short. Sorry, we just met. Dr. Priya Mathur is her vision is to help transform healthcare from a sick care model to a data-driven predictive model. She uses the science of AI and machine learning and has a precision medicine quality healthcare system that's affordable and accessible to everyone, imagine. Regardless of insurance or socioeconomic status, that's a big part of your mission, to help bring care and reduce those barriers. She's a frequent speaker on the healthcare circuit. Dr. Mathur is a healthcare visionary who believes that every individual and family desires to take charge of their health, but they often lack the time or information, or money and tools. So she's created an innovative health app that helps individuals and entire families take control of their health by making prescriptions affordable, for one, making treatment manageable, and having personal and family health data accessible. Imagine your own data to have it at your hands and to be shareable on demand in one easy, useful app. So welcome to. And sorry, we're missing a wonderful guest, but she had some travel delays, so sorry. In spirit, you're with us, Dr. Josephine. So our first question I'm going to ask and direct it to Babita first, if that's okay, is around the pandemic and how the pandemic has, everyone I'm sure is very aware how it's exacerbated mental health problems. That's not going to be a shocker for this audience, but we'd like to focus on how that's really exploded in social and what you're seeing that is being done about it that's working well.
It's a great question. As everyone is aware, under the pandemic was really the impact on mental health during the pandemic. And I would say that social media played such an integral part, first in a positive way, of people feeling very connected to individuals where you couldn't see anybody, there were lockdowns, there was quarantining, and also feeling connected out in the world to what I would call the collective trauma that was taking place. However, on the other side of it, in that sort of space of trying to continue to stay in the know and be connected to individuals, what started to happen is a term that's now called doom scrolling. And doom scrolling is where individuals are now relying on social media, where they're taking in a lot of negative news and a lot of, adverse impact. How many people have now, the death toll around COVID, et cetera, as well as other negative things that were happening. What that meant was individuals started to become very addicted during the pandemic to negative news and continued to doom scroll. That then, statistics show, elevated the amount of anxiety and depression, even loneliness, because they were just sitting there in that space of continuing to absorb a lot of negative information that now connected to them psychologically, and it became very difficult for them to get out of it. So even though we have a lot of different positive things around the space of social media and community, we also had the pandemic under the pandemic, which was that addiction, depression, and anxiety that happened during the pandemic.
Thank you so much. Dr. Priya, would you like to say something on that as well?
I think I would like to add a few numbers there. With the numbers, pre-pandemic, it was 1 in 10 in United States that, I would say this mental health related to social media were the numbers. But with pandemic, everyone having more time, staying at home, the numbers have increased from 4 in 10. Which is a big number. And I would say how we can see, especially the younger generation, that they are getting addicted to it is by seeing the behavior. If the last thing that they're going to bed is the phone or a tablet that they're looking at, or the first thing when they're waking up is that means they have started into the path, there's addiction or something going on. And I think its early check is very important, especially in the COVID time or in the pandemic. We were all like, families were together in house. So it was much easier for us to focus and be more vigilant. But I think this came all so sudden for being locked at home that we couldn't focus on that. Everybody got into positive but also negative use, as you just pointed, for the social media. And we observed whatever was presented. So I think the filters were not there, and that is something have definitely added to the problem and the numbers.
Yes, thank you, absolutely. And I'll add one comment too from the Gen Z focus, because that's where I'm currently focused right now, in terms of most of us get some pleasure in some way if we are fortunate enough to have a roof over our head and food on the table and access to health care, that some of the pandemic was a nice break from the hustle bustle of the world. For a lot of young people, school for them was a big part of their mental health, their buoyancy, their ability to feel praised and feel included and things like that. And when that was taken away, for a lot of kids, they retreated much more inward, and they didn't have the tools. They didn't. I was told that you don't call people on the phone. Apparently, when you're 16 or 17 years old, you send pictures of yourself. And there's really this whole new way of looking at who do you look to for role models, who do you look to for behavior models. And in the olden days, there were a few celebrities, there were a few athletes, there were a few Nobel laureates that everyone sort of gathered around. And now it's some person who's curated this faux persona of perfect happiness on a beach everywhere, and they just consider themselves other. They don't necessarily aspire to achieve, they actually feel worse about themselves when that is what they're bombarded with all the time. And so it kind of exacerbated that comparing and feeling other for a lot of young people. So there's obviously a lot of work to be done there. Okay, so next question. I'm not going to add on every question, don't worry. So what about some of these unrealistic expectations? I wanted to kind of follow into that. In terms of some of these unrelenting standards, this perfectionism that I was just speaking about, being preoccupied with it, and what are you seeing done to combat this? Jeff, I'd like to ask you that.
Yeah, so we know that the way social media is running and how it's programmed is to get people to stay on their apps more. There's a lot of filters and a lot of things that are happening on these apps now. I'm not sure if any of you are aware of the latest filter that came out, where you can actually remove people or remove things that are unwanted in your photo very easily and quickly, and then post it. Now, when you think about these social media apps and how that's working and all the unrealistic aspects, we also know that there's all these things going on in just how people are then perceiving themselves, and actually going out and getting medical procedures to alter themselves to fit more what their visual or their profile looks like. So as we're thinking about the mental health aspect and how that is impacted, it's figuring out, why are these things going on? What can we do to help prevent and curtail them so that we can reduce it? Right? Some of the measures that are out there right now is about how many followers you have, how many likes you have, how many comments are being posted to you from each person, why or why not. Our teenagers now are suffering from the aspect of, instead of dismissing a friend when you were in middle school and you going off and finding new friends, what's happening is you're moving away from your friends, but they're still connected to you on the social media. So they're learning and seeing that you no longer are friends that way. And it's starting to be impactful in their mental health, because they are starting to feel left out. They're starting to feel removed. They're starting to feel discounted. So we're having to look at what these expectations are in the social media and understand how we can move with changing the social media piece, but teaching our kids what this means. Not only do we say, well, they've unfriended me, but what does that mean and why? Is that happening in real life, or is that only on social media? How much of an impact is that in your life if it's just on social media? They blocked me. That's my favorite one from a lot of my clients. I've been blocked. My life is over. I'm like, really? Your life is over because somebody blocked you on their Instagram page? Hang on a second. Let's slow this down and look at what's going on to help you move forward. So it's having that information being put out there about what this actually is and how they identify themselves and what they can do to move away from that imposter identification to who they truly are inside and how they can represent that on the truth on the outside.
Thank you. Babita, did you want to add to that?
Yes, I'd like to piggyback on what Jeff was saying and look at it also from adults as role models for the younger generation, because this is also very systemic amongst adults too. The feelings that Jeff described that teens and adolescents are feeling, adults are also experiencing. And there's a real sense of feeling like an other when they see what other individuals are doing on social media platforms and measuring their success, whether it's in their jobs or in their relationships or what takes place in their families based on what they're seeing in social media. Now, what happens if you have a parent or an adult doing that and they're in a role of teacher or caregiver or grandparent, et cetera, if they're already having their own mental health impact, they will project that out to their kids. Their kids will see it, right? So I think what's also happening is what's very systemic is that as adults, we're also being very influenced and our mental health is being impacted by these platforms, and then it also trickles down to kids that are also being impacted by it as well. I think what comes up in practice that I see that clients are often saying is they don't feel good enough anymore. They feel there's a lot of pressure and competition in how they show up, whether it's in the workplace or personally, very impacted by also their own body image now, feeling like they have to be perfect, whether in the workplace or out socially. And all of this is very elevated because of what they are, how they're engaging on the platforms. So I would suggest boundaries, 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 really to sit down and think about, what platforms am I on? Am I using social media now as a form of comparison that's impacting me negatively? Or can I use it where I'm using it for maybe volunteering or connections of more positive ways? Figure that out so that you can help your kids figure it out.
Yeah, it's about teaching, right? It's about teaching them how to use it and to use it well. And we have to learn how to use it. And I think in a lot of ways we're still behind as adults, especially with all the stuff that's coming out now.
Yeah, and on the flip, I guess one area where there seems to be, again, statistically, this is an average, some positive change is actually with older adults who are coming into social media now, some for the very first time. And like was said earlier, it depends on, of course, the access point, if you will. Some of the more passive, press a button and watch it systems seem to be working. And again, I don't mean that in a condescending way, I just mean for access because they might not be familiar with the tech. But I noticed there's a lot of trends of seniors making TikToks, and it's a really great way to see people embracing technology as a way to be a bridge for their mental health, because they didn't have necessarily huge social networks up until that time, but their grandkids or their kids are getting them tablets to be able to connect and do FaceTime and see them because they're afraid to, go out since COVID. And it's actually kind of this burgeoning boomer social situation, and we're learning about everybody's, HIPAA beware. I don't know, because there was the NIH gentleman, but people are sharing everything and anything, but in a really wholesome way. You see people struggling with cancer recovery, being alone, being a care partner for a partner with dementia, that kind of stuff, finding essentially the beauty in the social networks that sometimes gets overlooked in sort of the competitive set that the younger side is going. So it's really interesting also for me to see sort of different new social baselines coming out across the different generations. Did anyone have anything to add, or can I go to the...
I think if I can add to this, I also feel like it's like the information has to be given when the information to be provided. And I think, as you just pointed about the elder generation coming into it, and actually for them this is more the platform to reach and to open and what they didn't have when they were growing up. It provides a new platform, and I would say a little more joy when your young kids are, your grandkids are not around. So giving the information at the right time, providing this social media platform at the right age is quite important, because you know what to filter and what not. You don't believe everything you see. As adults, we still filter. We still get fascinated at some times, but we still know what to filter. But these teenagers and young kids are still not experienced well enough in their life to know what is true and not. So I think social media is as a platform is not negative like that, but it's like who and when you're using it.
No, that's a great point, and that's what I meant too, I guess, as the follow-on final topic there is that the difference is that the young people are tech natives and they were born into tech, right? And so they are evolving their sense of self, their identity, and who they are with the tech. And the seniors and the older folks who are coming into it later, they're pretty fixed generally, right? They're established. So they have their heroes, their idols, their sense of self. And so they use it for, like, at a lighter level, and that's almost like the purest form, right? So when you think about children being the pure entity, we've actually seen the reverse. And so we were wondering if there are ways to take that joyful experience of a positive connection with a stranger or a positive connection with someone that you know and help for betterment and bring everyone up. So we can probably take a page from their habits. Okay, so can we shift a bit about some of the specific health treatments, mental health treatments that have been popularized through social media and what, you know, you are seeing be done about sort of balancing that pop culture mental health? You know, I think of a lot of the TikToks, excuse me, or reels, whatever you want to call them, videos on social around, if you're feeling this, like feeling depressed, do this. Here are 3 steps. And sort of like everyone essentially is a guru right now. There is, you know, life coach, mental health coach, wellness coach, that kind of thing. And also just, you know, Joe, Jane, whoever on the street offering essentially clinical advice. And some of them become quite popular. Jeff?
Yeah, so that's a great topic. We see a lot of armchair therapists nowadays, right? Everyone's offering advice. Sometimes the advice is good, sometimes the advice is coming from therapists and they're just rephrasing what the therapist has said. The aspect of the positives, and I'll get back to that in just a second, doesn't outweigh the negatives. At the same time, the negatives are simply that as people are sharing, we start to stigmatize mental health disorders. It starts to become this concept of it's a one-size-fits-all. If you have depression, you have to fit these standards or this criteria, and if you're not showing those, then you don't have depression, right? So Goffman characterized the term stigma back in 1963 that represented the less than perspective or less than human type kind of mentality. We're seeing that happen all over there, constantly still, where people are sharing terms online, saying so-and-so is this, so-and-so is that, and the comments. If you just read any comments on a lot of these TikToks, you can see some of these negatives unfold and how it creates this stigma, this stereotype. And it can also reduce some of the severity of mental illness. When we think about, for example, OCD, the latest term I've heard when somebody says, oh, I'm so OCD, is it's all about cleanliness. And we know OCD is a much bigger, much broader, much more in-depth concept than that. So those are some of the negatives when we think about the popularization of therapy. Now, great positives. It's really taken this back door or this back room approach of therapy and brought it to a light to say, hey, there's something to talk about. The Gen Z generation, as they're going about now, mental health is something to be talked about. It's something to be looked at and understood. I was in a high school recently, and one of the kids there was saying, I think everyone should have a therapist. They're amazing. I'm like, I agree with you. Like, let's move forward with this. But so we have to look at and understand, how do we then change that culture, this pop culture of what's stigmatizing things? How do we let them know that it's not a one-size-fits-all? Part of it is by us, by what we're doing here, by how we're approaching social media, by how we're getting on social media and sharing a generalized concept, but also letting them know that there are individual aspects that have to be met and understood, and how to help them move forward. That the treatment is not super easy all the time, that it's not a quick fix, but that it can take time, effort, and energy, but that they can do it. And I think that's the other big part about what's gone on, is that it is possible, and things can move forward for them, and they can find help.
Thank you. Carrie, I wanted to turn it to you. You're not safe. From your perspective in the marketing communication side, I'd be curious to see how some of your clients are thinking about this kind of thing in terms of their communication strategies.
Yeah, I'm kind of bringing a different perspective here today, but as a marketer and a communications person that deals with a lot of clinics, hospitals, from that perspective, indeed what we have seen, and part of this is a contributor to social media, right? But we're doing it in a different way. So some things that I have really seen has changed, especially in healthcare, is we're using social media, right? I mean, we have before, but what we know, especially since COVID, is we're taking data and we're taking content much more in a digital sense. So younger demographics, middle demographics, us older people, right? We're taking content, we're getting information much more digitally. So healthcare, right, in the client sector, we've really seen a lot of pivot changing, hence when COVID changed, we had to have a communications plan real fast, right? Telehealth happened. What are we gonna do? How are we gonna communicate this? How do we not only with our staff internally, but also with our patient network, right? And then our referring physicians and things like that. So definitely from our perspective, I would say, on the communication side, I think as a marketer and somebody who does content for healthcare, we have switched it to more value-driven, much more for the patient. So if we think back to healthcare ads, 20 years ago, right? I actually just spoke at a conference on this last week. I put up some old ads, like honestly, we had healthcare facilities saying, with smoking cigarettes showing in an ad. We've come way far, right, from what we used to say on that old ad advertising in healthcare into what we are today. But it's much more changed to value-driven for the patient. So instead of just saying, here's the clinic that we offer mental health practices, we're an orthopedic practice or whatever sector of healthcare that we're in, it's really changing that value of content. And I think we're all very much responsible for that, of making sure the content that we're releasing and the communications that we have is indeed helping our patients, is leading them in the right sector that we're talking about and the impacts of this, and also that we're customizing our content that we have for each of these demographics. Yes, in social media, yes, the TikToks. We didn't do that 5 years ago, right? We do that now. So, and making sure that the content that we're releasing is very much customized to the people that, to our audience with HIPAA compliant, but also much more value driven. There's definitely been a pivot of change in that, so.
Thank you. Babita, did you want to follow on with that in terms of communication and, maybe from the lens of, as a practitioner, in terms of what you feel like is sort of the table stakes now, perhaps?
No, absolutely. It goes into the basket of what are some ways social media can be used in a healthy, positive way. So for example, I think, Jeff, you were talking about some of the things around things being bundled, and we are sort of trying to move away from the stigma, but at the same time putting it into maybe categories that might be lighter than they should be, or individuals losing sight of particular unique journeys. So I do think what's important is, as a practitioner, the use of social media is in terms of valuable content. What are the resources that we are putting out? What are the resources that anyone in the healthcare field is putting out, even if one person takes that in and it can make a difference? But I also do feel that it's important to have that individual contact as well, so that there's more awareness around if someone is depressed, there's different levels of depression, right? If someone has OCD, there are different levels of it. And even though we've moved away that mental health does not mean mental illness, that we still are aware that we still have some very serious diagnoses, and it should be okay for individuals to know that and make sure that they follow the right paths in terms of the individuals that have the expertise around it, because there is a lot of misinformation out there, and sometimes it's not taken as seriously. I know just one more note that I felt like I wanted to say around this, just piggybacking on things that could be toxic, and social media is toxic positivity. When we're told, oh yes, if you do this, you can be happy, or the steps to happiness, or we all need to be resilient, and that doesn't work if you're experiencing trauma. That doesn't work if you're clinically depressed. That doesn't work if you're being cyber-bullied. Let me just be happy about it. These are serious issues, and I think it's important that those are also elevated, and if we use social media in the right way, it can be a really amazing platform to utilize.
Thank you. Does anyone have any follow-on for that?
Yeah, real quick.
Sure.
So there was a study done that was published in 2021 that took into account 11 countries over in Europe in 2020, spring of 2020. And they talked about how there was this formal integration of all of the social media platforms. And misinformation was the #1 area of concern, as rated by all these individuals that participated across those 11 countries. And it continues to be the case that misinformation is still very, very prevalent. And it's how do we get that content out to support people in understanding what the misinformation is versus the reality? right? Just because they have followers does not mean they understand what's going on, right? So it's figuring out how to structure it and really move forward in a positive way. Social media can be an amazing thing. It really can. It can really help people connect, families connect across countries, across the globe in a lot of different ways. Friends stay connected, right? But it can also be misused if not understood correctly. And it's how do we help them understand that to move forward?
Yeah, that's a great point. I think the credibility and the trust, which, you know, are huge, giant words, I know, in umbrella terms, but that's another sort of layer of filter that can be difficult to discern. And there's sort of competing priorities. So sometimes you'd say, well, you know, I trust this clinician because they went to medical school and they're going to be objective and that kind of thing. But yet, at the same time, people are more gravitating often to peers to look for, well, but they don't get me, or the doctors just want to push pills, or whatever their preconceived notion about why it's other. So I think that's another layer that we're dealing with, where it's sort of become an equal playing field across whose basically voice is the loudest, right? That's another differential that just made me think of, sorry.
Can I just add that one thing I would say is I would say that there's a lot of a lot of pivot change, right, that we're seeing. We're doing personalized content now. So we're having doctors do short videos and things like that. That we didn't used to do those type of things. So I think there's been a big change of having this personal approach to healthcare. People want that. We know that. I know I'm not a healthcare expert, but I work with you healthcare expert people. But I'm forced on my side of that to make sure that we're releasing content that's valid today, that's important today, and that we're also making a change for that. But it's that personal approach definitely has changed. Have you guys seen that with your practices too?
Oh yeah, a lot of people want that little video clip before they even come in, so they can feel like maybe that's somebody I can connect with, or I like the way they say that, or the way they're moving, facial structure, whatever it is. They want that video clip to say, that's who I can connect with, so I'm going to go in and see them. Oh, most definitely.
Yeah, I mean, it used to be maybe you looked up health grade or something in your plan that said, okay, this is where they went to medical school and this is that. And now it's like maybe they have an Insta reel about a surgery they just performed for a surgeon, for example. So there's really the table stakes for showing up and connecting with your patients, with your corporations, with your managed care institutions have completely shifted in terms of who is the customer and how do we communicate. So with that communication level, I'd like to shift it a little bit towards companies and organizations, whether they be just a regular manufacturer, a payer, you know, it doesn't really matter what, just saying a large organization. In terms of what are you seeing in terms of social and the shift there for within employer and employee groups and within communications and some change there. And I was wondering if I could toss it back to Babita for that.
It's a great question because there's a lot happening in companies, corporations, especially now around mental health, or sometimes they have it under the umbrella of, you know, wellness. What organizations are doing is they are sort of up-leveling their employee benefit around mental health. But what they're also doing, very importantly, around the social media aspect of it, is that they're creating more programs to up-level the education for their employees to understand the impact of social media and to make it a much more talked about topic. So similar to what we're doing here, there are panel discussions, there are town halls where the impact of social media on mental health is being discussed. Because again, it's a youth issue, but it's also, right, it's an adult issue, it's an all of us issue. They're also doing some more narrow things, for example, doing some partnerships with, you know, hospitals, healthcare organizations, physicians, and practices to put together events for their employees. And HR folks are doing that, you know, to make sure that there is spaces where individuals can either log in virtually and hear people talk about the topic of social media's impact on mental health and provide tips and tools, or to, you know, now attending more so in person. So I would say those are just some of the things that are going on in terms of organizations. I think the other one that's important is the C-suite or leaders of their various departments in, you know, larger corporations, multinational corporations. What they're doing is they're doing more individual newsletters and communications to their employees, and they're bringing in different topics, and one of them is, for example, social media. and really putting that out there in a very candid way and addressing mental health issues in their newsletters, but also putting in aspects around social media.
Thank you. Dr. Priya, did you want to add to that a little something?
Yeah. I'll just add, in a smaller organizations where you generally don't have, too many levels, I think they are still working, like in our organization, which is smaller, we're still working in a way, especially in the pandemic, taking the reference with the mental well-being. So I think the small groups, panels like that, or small group talks, I think in this HR department plays quite a good role in one way, because they are quite approachable, it feels like, to the employees as compared to going to a higher level, and they are better open up, talk. But at the same time, as you pointed, in the larger organizations, having the C-suite level people get involved, or executives getting involved in it, is quite important, because I think it's taken as a reference in an organization that if they are open to talk about it, it's okay to talk about it. So I think it always comes from the top bottom, kind of. So those approaches, even in the smaller organizations, I think have started considering how the social media can be taken for advantage and disadvantage for the corporate level also.
That's great. Jeff, did you want to say something?
Yeah, I was going to mention one of the things we're also seeing with the reorganization of a lot of these companies, the traditional mental health aspect as a practitioner was always you'd get 3 visits under an EAP, right? You could go in employee assistance program, talk to somebody or call and have a phone conversation. We're seeing a lot of larger companies and smaller companies even come out to practices such as myself, and we're creating specific EAP programs for those companies where we're integrating, now you're going to get more mental health support. You're going to get a lot more options to come in and actually have either in-person or telehealth visits. We're going to integrate our psychiatrists into that approach. We're going to bring in, if we need to, our medical doctor that we have on staff to figure out what else is going on the physical side. So as we're moving in this role, we're seeing the mental health field change, even though the larger companies, such as ones that won't be named, are still impacting their perspective. Companies are actually desiring to spend more funds to support their employees because they see that there's a positive impact on the employees and a reduction of negative employee aspects across the board, which then impacts the family, it impacts the whole community.
Absolutely, and I'm sure most of you have seen this from LinkedIn. It's not a shock, but following on from all that, if you look at the way the C-suite folks, who quite frankly didn't always show up, if you will, unless they maybe had, they were at the level and they had a publicist or a whole team behind them, but you're getting sort of the human side of executives showing up on LinkedIn talking about their commitment to their employee wellness and betterment as their post, instead of essentially more accomplishment and award signaling as the post. So I think that's another way that we're seeing, social platforms. We were talking a lot about Instagram and TikTok, but also LinkedIn and professional networks and forums and social, because social can be any of those things, and how we are sort of breaking down some barriers in a positive way. So I want to transition to asking each of you about a positive example of positive change in terms of social and mental health since the pandemic that you've seen sort of a burgeoning area of positive change. Just turn it to you because you're next to me.
I think talking about positive, for me, social media is like, it's a TV where you don't have to pay for the commercials. So,
well, you pay with your data, but we'll talk about that later.
Yeah, with the data part, you do lose a little bit there, but it's like you can talk to a larger audience and be more real. I feel like for a commercial or a corporate point of view, and even from an individual point of view, you can still put your point of view. You can still talk about some topic without, you need to have some boundaries talking about it, but still, you can be you talking about it. So social media platform positive for me is like, yes, it gives you a platform. You can reach more people, more audiences.
I would say that definitely, I think there's a lot of positive things when done right. I think it's education, right? There's a way that we can get, from an educational standpoint, that we can get data much quicker and faster than without that, if we didn't use that. So definitely, I think, like I said, the personalization I've seen from the business sector of that, from healthcare, is doing very good things by being able to get out resources and educational tips and things like that to patients and for patient healthcare. when used right? So I think there is indeed positive things that can be of value for that, and it's cost effective for our clinics and things like that to be able to reach a bunch of saturated amount of people and be able to give educational value.
From my lens, there are a few positive things. I think, first of all, it has helped to normalize that it is okay to take care of yourself and your mental well-being just as much as it's okay to take care of, right, your body, et cetera, to really think about, you know, what's good for you as far as your own mental health. It also has helped individuals in a really positive way who were afraid to speak up. And then it helped normalize it. So individuals that were more isolated and may not have had the kind of connection that they needed and were very afraid to be able to have their voice or to kind of be able to connect with other people. I think social media platforms, those communities have really helped with that. If we think about, you know, suicide awareness, if we want to, I know it's, you know, we're going into a whole other direction right now, but I do want to say with social media, they're, you know, reliable resources to be able to elevate how important that is to pick up the phone and get help. And what a huge outreach worldwide to be able to do that on these platforms was really important. And then, you know, I think someone brought up LinkedIn. I have to say, being a LinkedIn user myself, I do feel that that's a great social media platform because look at all of us here and professionally being able to network in that way. And as was also mentioned previously, the C-suite having their voices to be able to show some vulnerability around their own mental health has been extremely positive.
Yeah, I want to echo everything that was said there. And I also want to mention that I think in the pandemic, it was a real highlight to what was going on. It helped us see a lot of these things that were needed. I do think the term social distancing was a misnomer. It's not something we should have said or done. It should have been physical distancing, but socially connecting. And I think through social media, it allowed for a lot of the people who were isolated, a lot of people who were marginalized, a lot of people who were left to be by themselves, to still have a connection. There was a lot of Zoom parties that I heard about, a lot of these types of connections that really never happened prior to it. So social media is a great thing when done well or when done properly. It's more about the educational aspect of how do we go about this? When is the right time to share information? What information should be shared, right? I don't think a 10-year-old should be sharing his home address, but we see that. So it's helping not only the younger generation, but also our generation understand how to move forward with the social media. It's here to stay. It's not going away. In fact, we're going to see a lot more social media type platforms coming out that are going to be more dominant than some of the ones that are currently here because it's the generational piece that starts to pick up. And it's what do we do with that and how do we help our kids, our families, our friends move forward.
Thank you so much. So I guess we're at the time where I'm hoping you guys are awake and have, you know, it's not lunchtime yet, and somebody can help us out. And if anyone has a question, it would be a great time to come up. Thank you.
I think there is a lot to be learned from people who refrain from going to social media. And many of these are extremely accomplished people and have in real life, and if we call it this way, a lot of influence and impact. So if I may summarize my impression from these people, I know some of them, the main problem is you really have no control of who will address you at all. In real life, you have that to a large degree. And one of the reasons for that is there is no such thing like social media credit score for a person, right? And I wish we had that. So a credit score for a person where you can prove that you are well behaved, you use proper language, you acknowledge reason and cognition, and you have no bias, unjustified bias.
You are who you say you are.
Right? Yeah, good behavior. So in real life, we can learn a lot about what we need in social media. That's my opinion.
That's fabulous. Thank you so much.
That may not always drive followers, though.
This is kind of a two-parter. For patients that are turning to social media and finding themselves self-diagnosing, what are your thoughts? And also, how do you think we can bridge that gap between people self-diagnosing and getting in to see medical professionals to either validate or contradict that diagnosis?
That is a fabulous question. We were actually talking about this in the hallway, so we may be, that was a softball, thank you. Do you want to answer that?
Yeah, I will take a part of it, and that is what with our MediPocket, though we call it Dr. AI, so we do put the AI to it, but there's a doctor. And we always say that this is only a tool for you to have knowing your symptoms. It is nowhere where replacing a doctor or a clinician for that this is your diagnosis. So maybe if there's a way that they could be communicated the message that you can use the tools outside, like WebMD is a very good tool. But again, it's only for you to navigate your symptoms. It is not for you to diagnose yourself and then go and become a doctor to treat yourself. So I think that's where the awareness has to be done, and especially as the clinicians, us have to be, when the patients are coming and giving their, self-diagnosing themselves that this is what I read, be open about taking it, but maybe break it down with the symptom-wise. Okay, you put these symptoms, but this could be the 3 causes, and you're only taking one, but the probabilities with the, with the lab test and all could be this. So if you can make them aware, like just not blindly following what is being shown on the internet, not just social media, but any internet, I think that is where we can educate one patient, and this about awareness has to be increased.
First of all, fantastic panel. This is really fascinating. And second, especially during the pandemic, I know that loneliness was not just a mental issue, but very serious health issue for a lot of people. And they went to social media to try to fix that. But I think a lot of folks don't necessarily know how to identify what they're looking for to fix that loneliness. I was curious, what is your opinion on some of the red flags that people might encounter within themselves when they're trying to find connection but still find themselves feeling lonely on social media, even if they have 1,000 friends?
Did you just tell about my,
I know,
like
I
you
was
read
like,
my
wait,
bio or something? No.
That's like the sales pitch for my app. No, I'm kidding. So it's really, I was going to say, that's a really great question. Thank you. And it's a really layered question as well. So forgive my psychology answer in this moment. But I think we also want to address really quickly that it might be a very different approach and guidance for a different kind of person. So when we were talking about the seniors before, where we've actually seen it being almost a natural bridge to that loneliness gap because of the way they were experiencing tech and social for the first time was about connecting with family. Their family literally like mailing a tablet or something and saying, just press this and you can talk to me. Or type in something you're into. You like, nature, whatever, and you can find a group, and essentially using groups and things like that. We've also had a lot of laughs, if you ever look on Reddit or anywhere, about people not realizing when they're posting to a group versus their private thoughts. Those can be funny. And they help other people feel a little less lonely because they relate to some family member who has done that. But if we're talking to younger people, sometimes it can be a little different kind of guidance. And we often say, the gentleman who spoke before about look to the real world and how much can you mirror that. So what are organizations or institutions or places or groups or clubs that have a name that you know is a safe or good trusted source, right? And go to their membership or look there. So that's usually sort of what we try and recommend, at least from our side, is, find as many parallels to the real world as you can as your starting point.
Yeah, and real quick, what I would say is, if you're attempting to go about it in that form and you're not finding what it is you're looking for and you're not feeling the change you desire, then that's an indicator that what you're going after is not achieving you, right? The goal you want to have. So, and there's a lot that can go into that, but that's really it, is what you're doing achieving the goal you're going after?
So we have time for, I think, one last question. Thank you.
Hello, this was great. My business partner and I help run a rural clinic in Louisiana. It's a cardiothoracic clinic. We have a largely geriatric population, and we are introducing the clinic and our patients to social media. And we have a myriad of problems, poverty, connectivity in a rural area, you name it. My question is, we want our patients to engage. We want them to be involved in their health. They just don't seem to want to do it. Any thoughts on how to get a geriatric crowd more engaged through social media?
I always say that, there's layers, right? There's a layered approach to everything. So on the social side, again, who's the target audience? If the target audience is an older demographic, what platforms are we on, right? And are we on the right platforms that engages for that target audience? I believe in layering a lot of social media is one tool that we communicate with that, but to layer that with some other things. But I think with that, video, right? What we know at the end of the day is anytime that we do anything with video and custom, and what I mean by we're responsible by putting out the right content. But video today, just by results, and all across the platform, the more that we can do authentic, real, personal things, and in video, there's a higher engagement factor to that.
Okay.
And
we could have a
to add
sidebar
one, oh,
on
sorry.
this. Sorry, I was just going to say, since the time is over, I'd be happy to speak to you about it, also about their resistance, et cetera.
Sure, thank
Yeah,
you.
They
and
gotta be
I was
on
going to say,
TikTok.
and sometimes we do sort of, my marketing side too as well, we actually take offline traditional mailer tools. So we actually have made, little guidebooks about Facebook and things for seniors in terms of deconstructing all the clutter but putting that in a physical thing that they can touch, because that's the first barrier, that's the first comfort zone. And for video, mostly everything is digitized, but we still actually make DVDs that you can stick in a DVD player because they wanted those. So it's sometimes the delivery, so the video, but how they get it. Social, but how do I even start, and what do I do? Step by step, click here, getting them the ability to have that on-ramp. Sometimes that breaks down some of the barriers in and of itself.
And it's all about ease of use, right? Wholeheartedly. There's so much clutter nowadays on some of these things, on these apps. There are apps that are a lot less cluttered, that are
And
so much
designed,
more easier
they're
to
specifically
use.
designed for those demographics. So.
But I always think, know your audience too, different, and in rural marketing, right, and how they take content, may be different than if you lived in an urban area. So,
Right. Oh, it is.
talked about that too, so happy to talk, but there's, again, know your audience, what's the right way that they capture information and layer that.
Okay. Thank you.
Thank you.
So I guess we're done, right?
Yeah, thank you.
Okay.
Now we do the mic drop. Thank you all.
All right, how about one more round of applause for our panelists there? Thank you, folks. Very insightful, engaging talk there. All right, everybody, put on your smiling faces, okay? Hopefully you've had enough coffee at this point in time. It's past noon, so you have no excuse. We're going to go out the door, take a right, and you'll see on the left-hand side the Mirage Theater. We're doing a big group photo, and we'd love to have all of you there with everybody who, is in the other conferences as well. So, and then right after that, we'll break for lunch and meet back here in an hour. So thank you once again, and enjoy the picture, enjoy your lunch, enjoy talking to your colleagues. Ladies and gentlemen, welcome back. Hoping your bellies are full and you're ready for a nice afternoon of learning and networking here at Health 2.0. Once again, my name is Brian Panarelli. Welcome once again. And without further delay, let's go ahead and jump into a speaker session, which is on the subject digital bookmarkers for precision brain health assessment. While healthcare providers can easily collect psychological data to access physical health, the same can't be said for brain health. Here, anyone would be tempted to ask, what are the innovations taking place to change things for the good in the field of brain health assessment? To give us an idea, I'd like to welcome to the stage Mr. Mark Edwards, who is the CEO and founder of ViewMind, Inc. Please put your hands together for this gentleman.
Well, good afternoon. I'm Mark Edwards. I'm the chairman and co-founder of ViewMind. I'm going to be talking to you today about digital biomarkers for precision brain health assessment, which is the area that we operate in. I need the clicker. Here we are. So the first thing I'd like to do is just to discuss the prevalence of brain health neurological issues. And I have a question for you. So how many people in the audience know of somebody who has some kind of neurological issue, which could include things like depression, a concussion, Alzheimer's, mild cognitive impairment, multiple sclerosis, Parkinson's? I mean, the list goes on. There's many neurological issues. So how many people actually know somebody or know somebody who knows somebody? So it's pretty much everybody in the audience. It's a very prevalent challenge. 1 in 6 people in the world suffer from a neurological disorder, according to the WHO, and 60% of these disorders go undiagnosed. And that percentage rises when you go to underserved communities or to developing countries. The percentage goes up to 90% are undiagnosed. There's also a high level of misdiagnosis. So even when there is a diagnosis, in the case of multiple sclerosis and Alzheimer's, it's about 20% of people who are diagnosed with those diseases don't actually have those conditions. 30% in the case of Parkinson's, and a major depressive disorder goes up to 65%, and that's data from the NIH. So even if somebody is diagnosed and they're correctly diagnosed, there's also a challenge in terms of doing disease management, actually assessing how somebody's dealing with a particular drug and whether that is the right drug for them or whether they need a different dosage. And it's a very subjective process. And really what we need to provide physicians is more objective tools to be able to measure the exact impact of the drugs. So ViewMind has a novel technology for measuring brain health, and we access this information through the eye. The eye anatomically is part of the brain, and it provides some unique access to brain health information. And I'm going to just show you a short video, and I think this gives you a good introduction to the technology. And so if we could just, Manny, just move over to the video. most important organs. We want to have a healthy life. We want to have a long lifespan. With neurodegenerative disorders, the pathology can develop for many years before there are symptoms. The disease could be in progress for maybe up to 2 decades before symptoms become evident. By the time the symptoms are noticed, then a lot of the damage has already taken place, and it becomes very difficult, if not impossible, to reverse that damage. But if we can catch the symptoms sooner, then therapies and treatments can be developed which can intervene in the earlier stages of the disease and have a much better chance of stopping or delaying the onset of symptoms before damage is irreversibly done. ViewMind has developed a precision diagnostic solution for measuring brain health. To measure brain health, we need to measure 2 things. Firstly, cognition. Cognition is how we process information, how we remember things, the speed of how quickly we process information. We also need to measure the physical health of the brain. It's been known for a long time that eye movements change as a result of changes in cognition. And much has been written about this in medical journals, but nobody's been able to build a robust diagnostic solution to tap into that signal from the brain. And that's what ViewMind has been able to do. The eye is the window, is a reflection of your brain, not only anatomically, but also functionally. The way it moves, the way that actually you can pay attention to somebody or not, the way that actually the eye moves during different normal and abnormal, brain states really helps you to determine and diagnose specific diseases that are difficult to diagnose otherwise.
Since the last 18 years, we are relating different eye movements with specific cognitive functions and related areas of the brain. Currently, the analysis of eye movements allows ViewMind to identify how different diseases affect a person's health.
Chemical biomarkers are measuring the body chemistry, identifying, for example, if a protein is in spinal fluid. Digital biomarkers, on the other hand, are capturing information which is purely digital, and then the data can be analyzed and patterns can be extracted, which could provide an indication as to whether somebody has a particular issue or not. So a digital biomarker in the case of ViewMind is that we are capturing eye movement data. ViewMind is a medical device, and it also includes digital health software. We don't make the hardware. The hardware is provided through a partnership with Hewlett-Packard, and we use a combination of their virtual reality headsets and the HP virtual reality computers.
We provide extended reality technologies as fundamental technologies, and then our partner ViewMind develops specific solutions on top of those fundamental technologies to improve the well-being of their customers. So for a VR setup, our solutions right now focus on PC-attached VR. We have a VR headset called the HP Reverb G2. These VR headsets attach to a laptop or a desktop computer with powerful enough graphics that it can support virtual reality headsets.
Assessing a person is a very simple process. Our product is comprised of a VR headset and eye tracking, a laptop, and ViewMind's software. A patient undergoes a 15-minute test, data is uploaded into our servers, and an actionable report is sent to the physician to access, which contains data that they can use to make a proper diagnosis.
I believe that ViewMind can become the gold standard in neurological healthcare diagnosis. But I also believe in the future possibilities of ViewMind in making a significant contribution to the situational readiness of our nations, of our companies, and of our societies.
I think the future of medicine is prevention. We are developing therapeutic options for people that present, specifically actually brain diseases, by being able to screen millions of patients and diagnose the ones at risk, can be very, very impactful for society. Tools that are fast, quick to implement, and actually provide easy access to patients, can really disrupt the way that we diagnose and manage neurological disorders.
we're very excited about the potential impact that the technology could have on millions of people's lives.
So this is the headset, and the way the technology works is that the patient puts on the headset, their eyes are exposed to a visual exercise. This exercise stimulates and activates specific regions of the brain. The exercise takes 2 to 4 minutes. There are maybe 3 exercises that are undertaken in a battery of tests to look at different brain regions. During that time, we would have gathered 100,000 data points, and this data is fed into an artificial intelligence system in the cloud that correlates the patient's data with particular pathologies. The advantages of ViewMind is that, firstly, it's ultra-high sensitivity and specificity, the highest of any technology that exists. It works independent of age, culture, and education, which is very important, and a lot of the existing tests that I'm going to mention in a moment have dependencies. It is non-invasive and affordable, and it also correlates to some of the gold standard tests to look at physical brain health, such as a lumbar puncture or CSF, a PET scan to look for beta amyloid or tau in the brain, an MRI, and EEG. It can also, because of its ultra-high sensitivity, be used for a preclinical diagnosis, so you can look many years even before symptoms present and actually see cognitive changes that are taking place. It's so sensitive you can even measure the impact of drugs on the brain and how the brain is altering in different regions. And it is a platform that can be used for a variety of different neurocognitive or neurodegenerative disorders. So looking at some of the standard ways in which cognition and brain health are measured today, on the first column over here you have cognition. And pen and paper testing is really the staple of how this type of testing is done, looking at memory functions, the way we process information, and things like the mini-mental is one such test, or Adams-Brook test. There are some computer-based versions and iPad versions of the same tests, but they still, the sensitivity and specificity is better, but it's not dramatically better. And then you have various different biomarker tests and neuroimaging tests such as a PET, CSF, MRI. Evoked potential is used for certain conditions like multiple sclerosis, and blood assays are also used as well. The challenge with these tests is that whilst they produce good results, they are invasive and they are expensive. PT is perhaps $4,500, a CSF is about $3,500, MRI maybe about $3,000. So they're very expensive tests, and really you're only going to have that test maybe once a year, and probably only if symptoms have already presented. It's certainly not going to be done in a preclinical stage. So ViewMind has the advantage that it provides ultra-high sensitivity and specificity beyond anything else that exists, and it provides a correlation with all of these other tests, yet it's not invasive and it's affordable. And in addition, one of the key things where ViewMind is really excelling in you could say, a new category is what we call evidence-based disease management. It's the ability to provide the physician with data, objective data about the patient, how they're responding to a drug, and being able to make clinical decisions that could alter and improve the patient's journey and the course of treatment. So in terms of clinical validation, just to give you just a little snapshot of this, we've done a lot of studies. We've done studies on over 2,000 subjects in 30 different studies in 3 continents. We are particularly focused on multiple sclerosis. That's our primary area. We also have done a lot of work in the area of Alzheimer's and mild cognitive impairment. And then we are doing studies, some other studies in other areas. Parkinson's disease, we're about to start a study in Asia, in this area, a large study with the government. Depression, differentiating between unipolar disorder and bipolar disorder, which is very difficult to differentiate between the two. Long COVID is another interesting area. I'm going to mention more about that in a minute. We're just about to start a big study in Europe with the Luxembourg government. It was just announced a couple of days ago. And we've also been using ViewMind as a digital therapeutic and showing how we can use the technology to enhance cognition and then measure the minor alterations in cognitive functions as a result. So just to give a few examples of some of the results we've had in certain studies, one study was to see if we were able to predict if somebody would convert to mild cognitive impairment, if they would convert in the future to Alzheimer's disease. And this is a prospective study, so it was done over a period of 4 years. We started with 105 subjects. We identified 63 had mild cognitive impairment, and we predicted that in the future, 34 of these subjects would convert to Alzheimer's disease and that 29 would not convert. It's obviously these 29 that would not convert, chances are they would convert to something else, like could be Parkinson's, frontal temporal dementia, Lewy body, some other type of dementia. And over the course of the next number of years, after year 1, year 2, year 3, so by year 3, 32 of the 34 we said would convert had converted, indicating a positive predictive value of 94%, and none of the ones that we said would not convert had converted, which is a 100% negative predictive value. So this is beyond any technology that exists in the world today to do this type of analysis. This was presented at the AAIC, the Alzheimer's Association International Conference, in 2020 and 2021. Another study that, just to give you some highlights of, oh, I went too far. This is a very interesting study that was done of patients that have a genetic disorder called familial Alzheimer's disease, which means that unfortunately they will unavoidably develop Alzheimer's between the age of 48 and 60. And we're able to study them earlier in the pathology between the ages of 28 and 35. So we know what their future journey will be, and we can study them, up to 20 years before symptoms. They've had a whole battery of different assessments. They've had PETs, MRIs, CSF, and so on. And we were able to differentiate in a blind study the FAD subjects from healthy controls with a 96% sensitivity and a 98% specificity up to 20 years before clinical symptoms. And the reason why this is very important and a very profound result is that the pathology of familial Alzheimer's is similar to generic or sporadic Alzheimer's. So you start to accumulate beta amyloid plaques in specific areas of the brain, and that correlates exactly to what we're picking up and detecting with our analysis. This is going to be presented at a plenary at AAIC 2022 this year in San Diego in the end of July, and it will be with the PIs on this are very well known, some of the leading KOLs, key opinion leaders in the world in this field. Another study to reference is in the area of long COVID. And so in this study, what we were doing is assessing the neurocognitive deficiencies in subjects who have recovered from COVID 6 months out. Now, there's a lot of evidence already accumulating that a lot of people are getting neurological issues, long COVID, brain fog, and so on. The Lancet did a study of 234,000 people and found that 33.6% had neurological impacts 6 months out. So we were measuring people who had recovered. They weren't hospitalized, so they were, let's say, doing better than many people have. And the results are really profound in that what we found is 6 months out, when solving tasks, that they were between 44 and 49% slower in terms of solving tasks. And one of the worries and concerns, I think, in this area is that it's known that long COVID causes neuroinflammation, inflammation of the brain tissue, and neuroinflammation is one of the things that is also a factor, part of the pathogenesis of Alzheimer's disease. Now, we don't necessarily understand all of these connections right now. There's more studies and work that needs to be done, and that is one of the reasons why we're about to start a major pivotal study with the Luxembourg Ministry of Economy and the Institute of Health to assess this in more detail and provide evidence-based data for clinicians to be able to help treat people who have this condition. these are some of the publications that we've done. We have many publications in different journals. There's also many that will be coming out over the course of this year. We have ANMAT and CE approval, which is the European and Latin American approval, and we're in the process of pursuing FDA approval, which we hope to get towards the latter part of this year. And in terms of some of the momentum that we have, we're deploying in hospitals. We have some major U.S. hospitals that we're engaging with, and hospitals in Europe, also in Latin America. We were awarded, very humbled to be awarded by Frost & Sullivan, the market analyst, with a Best Practices Award last year. We have a growing amount of clinical validation taking place. By the end of this year, our run rate in terms of clinical studies is going to be, in a month, equivalent to half of what we've done over the course of 5 years. So things are really ramping very quickly. And we do have a number of partnerships, one of which is with Hewlett-Packard on a global basis. We're one of their key partners using their technology. So in summary, ViewMind is a company that is offering a novel approach and I think a very high impact, important solution so that we can be more proactive about managing our brain health rather than reactive and just dealing with issues when we have symptoms, by providing evidence-based neurodegenerative disease management. So thank you very much, and I think I left a reasonable amount of time for questions, so we're open to any questions that the audience have.
Yeah, first of all, that was really interesting. I work in inflammatory biomarkers, and this is phenomenal. I was curious about, you were saying the affordability. That's still a pretty wide range. Are you talking affordable in terms of implementation in a large hospital, or affordable in terms of implementation for like a small neighborhood clinic?
Both. I mean, we see eventually that initially our focus is to work with, let's say, neurologists, specialist neurologists who are offering this solution in a clinic. But there are, I think, from what I presented, you can see that there are some significant implications in terms of, ultimately, we see this being part of the battery of tests that you have as an annual health checkup by a primary care physician. And so we see ultimately this is going to be in every doctor's office and be part of that, from the age of 35 onwards, this will be included in that annual set of tests that you might have. But initially, right now, our focus is on the neurologists and the hospitals to build that body of support from neurologists initially. And another gentleman.
How quick is the report time in regards to, say, if you're using it as an initial assessment, and then say you want to do some treatment from a mental health perspective, say something like cognitive behavior therapy or dialectical behavior therapy, and then doing a reassessment, say 3-4 weeks down the road, to see if there's any improvement or change?
Yes, so that's a great question, and I sort of two parts of the question. I think, firstly, how quickly is the report generated? The report is the deliverable. That's what we provide the physician. It provides information about how different cognitive domains are performing. It provides an overall sort of assessment. It also provides an assessment by brain region, and it also has some data so that you can see how the individual has performed the test. So the physician doesn't actually need to be present for the test to be undertaken. It could be somebody else, a technician, a nurse, or somebody who's doing the test, and the doctor can see exactly how the test was performed even though they weren't actually there. The report itself is generated in a matter of a few minutes. I mean, it's in the cloud. It's being automatically generated, and then the physician can access it from anywhere through a secure web portal. And they would have a login, and they'll be able to access the data from there. In terms of the second part of your question about sensitivity, it is one of the key things I'm personally very excited about is that this is ultra-high sensitivity and specificity. And we see this being used for evidence-based treatment. And we, if you're having a drug, somebody might get reassessed in a month. It could be 3 weeks, it could be a month, it could be a couple of months. And the same, if they're having some CBT, they could be reassessed in a relatively short period of time, and we'll be able to see changes because of the sensitivity. And we're providing the results in a quantitative way. So rather than if you're familiar with, say, mini-mental tests and you get a number, 35 or something like this, this is providing a much more fine-grained data that is, a scale between 0 and 100. And the other thing is that we're measuring certain cognitive domains that you just couldn't measure previously. I mean, there's no test today that can measure, for example, how quickly you're processing information. But because we're looking at the eye and eye movements, and we're looking in milliseconds, we're not aware, but the way we view information is that we don't linearly sort of move around, a page or a room. Our eyes jump, and they jump very, very rapidly, and they continuously make these jumps backwards and forwards. And these are happening hundreds of times a second, and we're not aware of this. And, somebody looking at a person wouldn't notice or wouldn't be able to see that. But we're capturing all of that. And so, we can provide that sort of very sensitive performance information about the speed of reaction that somebody's having to some of the tests that we have. Any other questions?
Is there a change depending on who's giving the test? Like if a physician's giving the test and the tech is giving the test, is there any?
That's a very good question. Is there a change depending on who is giving the test? The answer is no. I mean, it's been designed to take that out of the equation. Not only to take who's giving the test out of the equation, but actually the age, education, and culture of the person. Because, for example, if you're doing a mini-mental test, that can be very much influenced by the person giving the test. It can be influenced by the age, education, and culture of the person who's being assessed. And it's very important to take that away because we want objective data. So our technology works in a way where you could use it in a poor village in Africa, or you could use it in a cosmopolitan city, New York City or San Francisco. You get the same results. And it doesn't matter who does the test. And the physician can see exactly how the test was performed because we provide some of the raw data about the eye movements that they can see exactly did they follow the test in the way that they should have done it. It becomes very, very, very clear very quickly to be able to see that.
What if the patient has comorbidities?
Okay.
Are there any that could actually confound?
Yeah, so great question. So the question is, what if the patient has comorbidities? And one of the challenges with many, for example, dementias, is that comorbidities is often a factor. There are often more than one thing going on. And so one of the powerful things that we can do with the technology is that we can rule things out. And we can say, this person does not have Alzheimer's. This person does not have Parkinson's. This person does not have multiple sclerosis. So we haven't sort of covered everything, of course, at this point. We're amassing data all the time. But we can significantly contribute towards doing a differential diagnosis and eliminating certain things that somebody has, or including them into the assessment and the diagnosis of that particular patient's condition. So, any other questions? Gentlemen. Yeah. Sure.
How would this solution work in areas where internet is constrained or stuff like that, or is it just local to the device from the headset and then you can go back to connected to the main internet?
Okay, so the question is about the how would this work in a remote location where maybe there's connectivity constraints? And the technology works locally and captures the data. It does need internet access at some point to upload the data to the cloud, but it doesn't have to be in real time. So if you went to a remote village where there was no internet, you captured the data. Next time the computer was connected to the internet, the data would get uploaded for processing. Okay. Any other questions? Okay, well, thank you very much. Thanks.
All right, one more time for Mark. Thanks a lot, Mark. Appreciate you. His ideas and showing the way forward are much appreciated. I want to remind everybody in attendance here, if you're taking pictures for social media, LinkedIn, Facebook, Instagram, that sort of thing, please use our hashtag. It's Health2Conf. Health2Conf. That is CONF, and we'd love to look back at the wonderful time you guys are having here this week. Now we're going to move on to a panel discussion on the topic, importance of workplace safety and well-being in the health sector. Healthcare providers worked around the clock to fight against COVID-19, as we well know, and saved thousands of lives. But what about their own well-being? It's been 2 years since the global health crisis, and it's about time that we start talking about the occupational health of healthcare workers as well. To discuss how the healthcare community can make workplaces safe and healthier, we have a group of experts here with us today. Please welcome Kathleen Dietar Januso, founder and CEO of the Institute of Consultative Bioethics. Did I say that right? Bioethics, sorry. Who will lead this session? Please come on.
Good afternoon, and thank you for joining us for a discussion on safety and well-being in healthcare. Let me start with the introductions of our expert panel. Our first panelist is Dr. Ali Khazadeh. Ali is a medical futurist, a physician, and an entrepreneur. He is the co-founder of sick.org, a HIPAA-secure telemedicine and communication platform. He is certified in the American Board of Medicine with extensive experience with urgent care, primary care, and emergency care. He has taught at multiple schools of medicine and has authored and contributed to several bestsellers, including the USMLE, which is the United States Medical Licensing Examination. Thank you. Next, we have Amy Peters. Amy is the Chief Clinical Innovation Officer at Acellus. Amy has nearly 25 years of clinical experience in strategy, product and program development, and leadership in the behavioral health industry. She has developed and has led in the behavioral health industry. She has pioneered virtual behavioral health care, increasing access and high-quality behavioral health care to many of the U.S. largest health insurers across 50 states. Driven by a passion for promoting telehealth adoption, Amy serves as an adjunct professor at Columbia University, where she has pioneered and developed the university's telemental health care curriculum. Thank you, Amy. Next, we have Tracy Boss. Tracy earned her undergraduate degree at Strayer University in Washington, D.C. in information systems, and then she went on and got her master's in systems engineering and management. She has over 27 years in the field. She is a true trailblazer and advocate for holistic living. She is a healthcare IT manager for a local hospital and a certified holistic and integrative health coach, master Zumba, and liturgical dance instructor. She is also a life and health insurance provider. The next person we would have had on our panel is Evelyn Gray. I'm sorry. Welcome, Tracy. Sorry about that. Evelyn Gray would have been our next panelist. Unfortunately, she's still en route, so she will not be here today. All right, with that, let's get started. The ongoing pandemic has really disrupted every industry, but quite uniquely to healthcare, in ways we didn't even imagine or to the degrees we wouldn't have imagined. It affected our safety and challenged our well-being, both mentally and psychologically, as well as affected how we felt about our purpose and control of our life. But when we talk about healthcare, its importance is without question, right? But how did we do when we were put to the test? That's what we're going to talk about. And we're going to look not only at the challenges, but also the opportunities. So with that, over here, and we're going to roll. Oh, one more thing, we will have 15 minutes of questions at the end, and if you haven't already, silence your cell phones. All right, so let's begin. Oh, let's go back to the end of, I should be using this, at the end of 2019, beginning of 2020. You as a physician and as an owner of a practice, what were you thinking when you saw that happening? When it was coming out of Asia and Europe and it was early, what were your thoughts?
Sure. I'm a primary care physician. I own and run a primary care office and urgent care office, Newport Beach, California. So things happening in the Middle East and China and nothing going on in U.S. And I was talking to I'm originally from Iran. I came here in 1997. But I was talking to a few of my friends back there, and they told me they close their offices and they're seeing their patient through WhatsApp or Telegram or FaceTime or just simple phone calls. And again, we were partying here, nothing going on. So I was already actually co-founder of a different company that mostly was a communication platform. And we were doing the HIPAA secure text communication called Kilogram. And I was talking to my friend, so let's add a telemedicine software to it and let's give it, for free to a lot of physicians to use in the United States. So by the time, 3 months after that COVID hit us, we had that, software ready to go. My co-founder and CEO of the company, Shayan, sitting right there. So he actually used to work for a company called Skype, and we were able to actually provide that type of service to a lot of physicians in the United States to use it and see their patient through HIPAA secure platform. So
Physical safety. How about physical safety? At that point, what were you thinking about?
So mostly, the PPE. That was the problem. So we actually went and bought some masks and gloves and gowns. So yeah, we started early, so we had no problem doing that. But to me was why the whole country is not doing it. So and then we learned down the road that people using their masks several days back to back, the N95. And that wasn't healthy. And people, unfortunately, were divided to two parts, and half of the country wanted to use the mask, half of the country didn't want to use the mask, half of the country wanted to do the vaccine, half of the country didn't want to use the vaccine, right? And the burden was on the healthcare providers to, see them back to back to back.
Exactly. All right, Tracy, You're
Yes.
in infrastructure, IT.
Yes.
You're not really out there with the patients,
Mhm.
but you're with the employees, probably all of them doing something, or people are.
Right.
What were you guys feeling? Were you feeling the issues of safety or well-being, or when did it happen?
So, to be honest with you, our organization, Innova Health Systems, is kind of the trailblazers for and kind of incorporating to take those vaccinations. But our mission and value has always been patient first, right? So with that patient first, that means that we also have to ensure that the technology is intact, to be there at the front line with the clinicians from an electronic medical record standpoint. And just, we actually felt similar pain as the clinicians because we had to make sure that we're supporting patient delivery, patient care delivery. That is our goal, even though we're not direct with patients. So that we definitely felt that. Some of our employees actually contracted COVID. And, but again, we took that sacrifice along with the clinicians at our organization.
Thank you, Tracy. Amy, your business is a little different. You deal with multiple clients across the United States. How was it? Did you see anything different or feel anything differently in the beginning?
Sure. One of the things that we noticed very quickly in the pandemic is that not only is physical safety important to our employees and to our patients, but psychological safety is really just as important, with a real increase, about a 60% increase in mental health, in folks experiencing mental health symptoms during the pandemic. It's very, very important for employers to also think about psychological safety, which is defined as an environment where individuals feel comfortable expressing themselves, being themselves, and expressing their ideas. And this is as important as physical safety. A recent Gallup poll actually showed that only 3 out of 10 individuals feel that their opinions and contributions at work matter. And this has a very big impact on productivity, retention, and workplace safety. And so it's really important when we're talking about, the definition of safety for it to really be holistic.
Exactly. Now, did you, with the pandemic, and then you had, we started out, we thought it would be over by Easter, and then you had everybody at home, the employees went home. How did you deal with that?
So being in the telebehavioral health space for almost 14 years now, one of the things that was so exciting to me that we saw is that there was like an advancement. We advanced about 10 years versus 1 in terms of the adoption of telehealth as a very high quality way of delivering care to individuals. So, really first started in the commercial space, direct-to-consumer space. Then we had Medicare programs who, really embraced telehealth delivery. We now saw that much more broadly throughout the country and throughout the markets, including in the workers' compensation market, a dramatic and very successful shift to the delivery of telebehavioral health.
It was well accepted?
It was absolutely well accepted and, and here to stay.
Very good. Ali, would you add to that?
Sure. What we learned during pandemic was 70% of my patient I used to was able to see at the urgent care. Right now I can see them through telemedicine. And 20% I might able to send them a test delivered to their home. It's like a COVID testing or STD testing or urine testing or different type of testing. And 10% I have to see them physically. So this is before COVID. I was member of telemedicine, American Telemedicine Association. And we thought maybe in 10 years, less than half of my patients I'm able to see through telemedicine. But because of the COVID, I guess the silver lining because of the COVID was people accepting the telemedicine, and at the same time, a physician accepting telemedicine. And that change was sort of over time. Right now, over 50%, 55% of all the Medicare patients seen through telemedicine, and 30% of all psychology and psychiatrist visit throughout the United States are telemedicine. So I guess this is reducing the traffic, less gas usage, and patients don't want to go to, sit in that waiting area, dirty waiting area, get sick again with different reasons. So yeah, that's what we see in healthcare, sector.
So the productivity increased, and with that, did you see that, Amy, in your area?
Absolutely see productivity increase, and Ellie, I'd also share that in the workers' compensation space and telebehavioral health, we saw a dramatic improvement in adherence to treatment. So what was 30% no-show rate when care was delivered in person primarily, to a shift during the pandemic when care is delivered about 90% via telehealth, is a reduction of no-shows from 30% to less than 9%, and quite a lot of satisfaction between, from our providers as well as from the injured workers that we treat. And we've been able to really change the paradigm of quality of care for behavioral health in the workers' compensation space, because now being able to deliver care virtually, we no longer have to be fully restrained by the injured worker and the provider being in what was a geographic way of looking at quality. So it was looked at as the provider being 15 minutes or 30 miles from the individual, the patient, and now that that we're not restricted to that, we can actually get appointments sooner. We can also match providers with the best, with the right patients in their state, and so it's really a much more high-quality approach.
Excellent. Tracy, from an infrastructure standpoint, what has to happen when you want to implement telehealth?
Well, with the pandemic, it brought about an interesting imperative and a shift to now focus on our technology. So our organization is Epic. We have the Epic EMR. So with MyChart, the adoption rate was extremely low prior to the pandemic, but one of our major initiatives was to make sure that we got all our patients, and we were able to do that in a very short amount of time to get them up on MyChart, because we actually use an embedded technology there for telehealth. So it was definitely a push, and it was good to be able to, provide the clinicians what they needed to support our community.
Okay.
If I want to add something to what Amy said, was the only thing that pandemic changed was the insurance company willing to pay for telemedicine. On top of that, less rules and regulation, and I'm hoping those, rules and regulations stay that way.
With that, what type of procedures, what had to change in your organization to implement telemedicine? Did anything, procedures, practices?
We just have to understand the needs for people, that if somebody needs, for example, refill of medication, somebody need a test to be done, can we provide that through, telehealth, virtually?
How about your staff then?
Regarding the staff, I always said my job is to take care of my staff, and my staff job is to take care of my patients. Some of the rules and regulations that we did for our small offices was people get vaccinated and get booster. So also for our patients, we advise them to get vaccinated and a booster. I guess the silver lining of whole COVID was people understand the upper respiratory infection better, and they know how to avoid it just with a simple mask and, social distancing. So in a physical office, so we learn we better have a positive airflow to get the viruses out of the office instead of, so these are the changes we see at the medical facilities, yes.
Allie, just to acknowledge, reimbursement for telehealth it really dramatically helped with that adoption curve, across the country for reimbursement for telehealth, regardless of the setting. And, there are a few other things that companies did have to consider in the shift to telehealth. So they did have to make sure that they were adopting a HIPAA-compliant technology. They had to provide staff with training in order to deliver it. They really had to research the ability of their patients to engage as well and think about some of the disparities that are inherent in some need for technology engagement and reduce some of those barriers. So many companies brought on technologies that you don't only need a computer for, but you can connect with via your phone. And it helped to promote more equity in terms of bandwidth in states where and regions where attention to bandwidth and attention to addressing issues of equality. It's also really important to make sure that state licensure and licensure requirements for the delivery of telehealth are addressed, as well as a few other regulations that I think hopefully are here to stay with making for continuing access to telehealth services.
So it sounds from you guys that we didn't really have too many problems with safety issues in healthcare during this time period. Anyone?
I would beg to differ. Speaking about psychological safety, the fact that I work in IT, the fact that the sacrifice of a lot of our infrastructure workers who are on the front lines with the clinicians, they were really ultimately concerned about voicing their opinions or thoughts about what's going on with the pandemic or their particular safety. So we had to shift to more of, kind of a Zoom setup, but also to be able to focus on our employees and their psychological safety and just overall well-being. So I think some of that has just kind of been missing. It was definitely missing. And not only that goes just for our employees, but for the patients alike. So I think it was very important to focus on how do our patients and our employees actually feel about what's happening and being okay to talk about it.
Yeah, I do think there are continued challenges just with getting healthcare to folks and, to think about who are our most vulnerable populations, and some of them are the ones that are responding, to the pandemic and are continuing to respond to the pandemic. So that includes our frontline healthcare workers who are taking care of patients with COVID and who continue to have increased exposure to contracting COVID. That goes for our first responders, our police, our EMTs, who are responding to increases in overdoses and suicides that are happening and violence in our communities. And so our frontline workers who are responding to the pandemic have more need than they've even had before the pandemic. And it's really important that we make sure that good health care and high quality health care is available to them. So they are vulnerable to conditions like PTSD and depression because of the nature of the work they're doing and the traumas that they are exposed to as part of their job. And so really important to make sure that their mental health is taken care of as well as their physical safety.
And how did you do that?
So, so there are in our organization, there are, in terms of our employees ourselves, we did, make sure we really had to transition to more folks working at home, and so we had to make sure that we were building more connections, collaborative tools to work together, town halls to meet together, make sure that folks knew that they had access to testing, to treatment, and that mental health services were available to them as well.
Anybody else?
So what we did, we reduced our hours from 8 to 8. We reduced it from 8 to 8 to 9 to 5, but we provided, telehealth in between, and sometimes all the way through midnight. So every day that we were going to people houses and delivering the COVID test to them, to either do the rapid test or the PCR test, I was going to the bed and I was hoping that I save few lives, because we didn't want people to get out and go to the test center and get tested, or go to the pharmacy and get tested. So if you test them at their home, so you can actually reduce the risk of, giving this disease to other people. So that was the
So you actually had people that went to their homes and picked up their tests and brought them back?
correct.
And you worked multiple shifts?
Correct. 3 shifts.
3 shifts?
Right.
Very good. And did you find that your business increased during that time period?
Absolutely. We were seeing like 1,000 patients a month before COVID to a couple of thousand patients a day during the COVID.
Tracy, did you see anything from your perspective that your company did for well-being, or maybe yourself, what you did?
One of the things specifically for my team is, wellness check-ins. So we have wellness check-ins during work hours to check in on our staff to see how they're doing. But we also have coaching at our organization, and me being an integrative coach, so I definitely kind of pioneered that effort that we need to know what's going on with our people, and they should be comfortable with talking to us about what may be bothering them outside of what's happening at work. But I think having those supports in place for health coaching and actually having them available to workers, whether it's just IT or any other of our employees at the health system, was great to have.
Was that difficult of a transition for some of your managers and leaders to have to do that type of wellness check-in with their employees, talk about wellness?
Listen, I did a presentation to most of our IT organization, and at first they were like, well, we don't have time for wellness. But I think once they kind of understood that you have to be able to connect. We work with each other all day. So it's really good that we connect with each other and make sure that we're good. And so it is extremely important because I care for my team, but I think initially it's definitely a difficult discussion to have with some of the leadership, but once they understood that, hey, this is not only going to boost morale for the team, but when they know you care, they care more.
Did you have that training in your organization previous to COVID?
Actually, we had some wellness activities, but it wasn't to that extent. So wellness has definitely increased in our organization. And again, for me, I definitely kind of want to boost up my team, so I do as much as I can. We just had a gathering not too long ago. But it's just, you want to make sure that your team is okay, and that if you take care of them, they'll take care of the patients. That's my motto.
Does your organization provide training for wellness to your clients as well as well-being, to your clients as well as your employees?
Absolutely. We provide training to our clients about the best ways to engage their employees, and we know that for folks who do need to go off of work for workers' compensation, we know that when an injured employee feels connected to the workplace, and when they feel when they feel connected and valued, and when those folks who are managing their claims are also validating that they've been through a stressful and are going through a stressful experience, we actually see that those injured workers go back to work more quickly.
And you mentioned PTSD, excuse me. Can you explain a little bit more how that affected healthcare workers and how you address that in workers' comp?
Sure. Sure. So post-traumatic stress disorder is a condition that's fairly, common for individuals who are exposed to, for example, during COVID, healthcare workers were seeing not only their patients pass away, but they also may have had family members, and they may have had coworkers who passed away. And, sort of seeing that over and over again can lead to some symptoms of post-traumatic stress disorder. Sometimes these folks do need to take a period off of work, but they certainly do need to be treated for the post-traumatic stress disorder that has increased. And there are very effective evidence-based interventions for treating post-traumatic stress disorder. Some of those include trauma-informed cognitive behavior therapy, cognitive processing therapy, and some resilience-based training. These are all really effective tools and treatments that can be delivered via telehealth, and that are short-term treatments. Folks can go back to work within about eight weeks of treatment with a very high-quality provider.
Ollie, you mentioned that one of the benefits with telehealth, there's many, but related to that is the availability of you being able to see the environment, the social determinants that might be affecting this patient through telehealth.
Sure. Two things in telemedicine important was, one is accessible, two is getting paid, right? So because of the COVID, these two things happen. And what I learned in the first few weeks, first few months of seeing patient, I was able to see them at their own home. I was able to see their home situation. I was able to see if they live in an apartment or big home, or, if they look depressed, or, everything is a mess. So I was able to learn a lot about their home situation. On top of that, I was able to see them more often. When I see them at the office every 6 months, so I have no idea what happened between those two visits. But when I see them through telemedicine, I can see them more frequently, and I can actually gather more information. So that was helping me a lot.
Do you feel that we've moved past the initial stages of implementing telemedicine to help, and that what are we looking forward to in the future now that we're...
I guess in future is going to be a point of care. Right now it's doctor's office or hospital. It's going to move more to our people home. So instead of hospital, you have hospital, and people get treated at their own home. But telemedicine is here to stay. Telemedicine is not going anywhere.
How about either one of you? We're going to be going into questions relatively soon. Would you like to add your thoughts about the future?
I definitely know that technology is here to stay, and I do also believe that mental health is important. Myself, studying to become a dance movement therapy, I think movement is a tool that we can use, but ultimately I don't think in this country we do enough to support mental health. So I'm anxious to see how that'll open up more for us across the board, even from an insurance payer perspective, and the different alternatives. So.
And the stigma.
Yes.
Amy?
Sure. I'm certainly optimistic about, really the adoption of telehealth and digital technologies, and absolutely, now that many of these modalities have proven to be effective, I'm very optimistic that our employers and our health systems will continue to make these treatments available to folks and make sure that we really are treating the whole person, so that we're always considering the physical, mental, and social well-being of our employees and our communities.
What's your one, for each one of you, your last piece of advice you'd give the audience pertaining to this topic of safety and well-being?
I guess a couple of things are important in general. Mental health and physical health.
are equally important. I always ask my patients, when was the last time you checked your brain? And they're confused. What do you mean by checking my brain? Say, when was the last time you see a therapist? Say, 98% say never, right? So I guess piece of advice is take care of your mental health is way more important than a lot of other things. At the same time, make sure your physical health taken care of as well.
Amy?
I would say really encourage folks to tap into their employees and have their employees be part of the solution to address well-being at work and psychological safety at work. Our employees sometimes have the most creative ideas for what will work for them. For example, at our company, some things that we got feedback from our employees, and we ended up during this pandemic actually launching a unlimited vacation policy to make sure that our employees really did feel like they could take time out, for their mental health as well as time out to travel and be with family. So make sure that your employees are part of the solution.
Excellent. Now let's open it up for questions. If you have a question out there, please come to the mic. Give us your name and your role, what you do, and who your question's to. You've been an active question.
My name is Abdul Qadir Ramo. I'm a biotechnologist. And we were continuously working during the pandemic because it's our duty to stay put forth solutions for this pandemic. And what we noticed that some of our members had mental issues, and that these mental issues came after COVID. And it was not because of their isolation. So it's not psychological, it's maybe organic. So the question that I have, can I actually force them into taking tests, mental tests or psychological tests, so that they can prove to be still the professionals we expect them to be? That's my question.
I can answer that question. Something we call it post-COVID condition. So if you are depressed or have sleeping problem, shortness of breath, anxiety, PTSD, because of COVID, doesn't mean that you have to have the COVID positive. Means because of COVID you lost the job, or now you're in another job, but still you have the depression, anxiety. So yes, they need to go through the a visit to find out or figure out if they have post-COVID condition, which divided to acute post-COVID syndrome and chronic post-COVID syndrome. So if they have, so we can actually take care of them. And most of those services can provide for free if they're COVID related.
So do I have the authority to do that?
You can give them recommendation. Regarding the COVID vaccine, yes, you have the authority. The rest, I don't know what is the rules and regulation of every single state. In California, we can give people recommendation regarding mental health, not enforce them. Right.
Yeah, I mean, some additional thoughts are just to make sure that in the workplace that, mental health is seen, it's not stigmatized, and it's really seen as kind of acceptable, and to make sure that there are a variety of different resources for mental health that can be, that an employee can access, so that it really can be convenient. You want to lower the barriers so that it's convenient, that it's in a modality that will work for them, where they're more likely to engage, and where you're reducing stigma that's attached to it as well.
So does the insurance actually cover these cases if they are a consequence of COVID?
In some states.
In some states?
In some states.
Okay, thank you.
Question from someone else? No questions out there. Nothing on well-being, nothing on safety?
So to add to that question you asked, you can ask them or provide them a promotional health visit with their primary care physician, so primary care physician can educate them on the subject. So that's maybe going around that thing.
Hi, I'm Brian Poteet. I'm with Continuity Health Solutions. I'm also the owner of Dallas Functional Dentistry. And I don't have a question. I'm just going to add some comments about the workplace safety. Because in the oral health world, COVID is a direct enemy. And so in our practice, what we had to do and the PPE had to be different because it's based on fluid-based, not on aerosols, right? You're in that mouth. So it added its own barriers to our employees' safety, but being creative and asking them, we used our vacuum that we use for mercury. We used that as a mechanism with those patients and the PPE. It was a very challenging time because, again, the highest risk to practitioners were specifically in dental because they were right there in that cavity and that airborne aspects of how we go away from air-blown cleaning to scraping. So it was, again, one of those factors of revamping how we approach the patient in that care. Using texting for them to stay in their cars until they came up. Using mechanism, not allowing the valet to actually park the car. So it was just operationally very different. I mean, but challenges of how we practice and those pieces. I think just wanted to add those comments to the safety aspects.
Yes.
So
It must have given a lot of, it must have added to the workforce, your group, creativity and collaboration.
It had a lot of challenges financially, if you think about it, because our employees were small business, and we had to continue to pay our employees to keep them with that process. So if you look at average dental practice, it's 1 to 2 docs, right? So being shut down completely for 2 months in its own business operations doesn't mean that how you're running that operation. I'm proud to say we were very on the good side of that in our operations and in our financials in that component, but a lot of practice weren't. Dentists weren't aware of the PPE, being fluid-based, not aerosol-based. Some dentists and hygienists did contract COVID, did have severe issues with that. So, just as providers and this topic of workplace safety and how we approach it and those pieces, I just was adding a whole nother dimension, I guess, to the thought pattern on engaging your teams, asking them, hey, how do we approach it, using these mechanisms of, minimizing passing of patients in the hallways and those items. So that's all.
And let's be real, you got good managers, you got bad managers. And I bet all of the leaders, managers out there weren't really prepared to do this and to work with their staff. I think again, as the band said this morning, I'm a doctor. I am a doctor, but I'm not a medical doctor, okay? And from my perspective, it seemed like a really difficult thing everybody in healthcare was going through. I mean, at first you're heroes, and then the vaccination comes, and we're back to a culture of blame and shame. I think I have to give hats off to the healthcare community. I mean, it is amazing what you folks have done, either directly in the front lines with the patients, or behind the scenes, or ancillary support in some way in the business that you do. It's amazing, and I think it's really a credit to the healthcare profession. Any other questions? Comments? All right. I think that's it. Thank you very much for your time.
All right, how about one more time for our distinguished guests there? I'm sure each and every one of us learned at least one thing new with that. Very interesting topic there. Let's proceed to a speaker session. What is an experience ecosystem and how it can improve your healthcare practices efficiency? This is a question that the next session delves into right now. For answers to this question, we have with us Sean Nason, the CEO and founder of Mophie. He's also a silver sponsor for the Health 2.0 conference. This session is entitled Blown Up, Silos, Maverick Mindsets, Experienced Ecosystems. Sean, stage is yours, my friend.
Well, good afternoon. I'll see now I make this, I'll make you all stand up and do this. Good afternoon, everyone. Awesome, it's great to be here. I don't know if any of you have been outside, but I am not staying here and trying to get here. I could have probably flown because the wind is so bad out there right now, so be safe this afternoon. It is an honor to be back here at Health 2.0. And I want to share a little bit. That's from Lion King, Lion King. And we're going to talk about ecosystems today. And I want to start to give you a little bit of a journey about who I am and why this is so passionate to me. There I am, 19 years old, the guy sitting at the piano. And I was a musical prodigy, graduated high school in 1991. Went on to study jazz studies and piano and voice, and then traveled professionally for about 10 years. And you'll see my career journey here, why maybe some of this becomes passion for me. When I quit traveling, I went to work for this little company. I give a little bit of a hint, but how many of you guys know about Walt Disney? Any Disney fans in the room? Any big Disney? Okay, well, I'm going to actually give you a perspective of Disney today. So, I was very honored from 2005 to 2012 to work for the Walt Disney Company. I worked for Disney Cruise Line for 2.5 of those years, and then I became a Walt Disney Imagineer. Anyone in the room know what a Walt Disney Imagineer is? Everything. Yeah, they are the creative piece to everything at Disney, for a concept called from blue sky to implementation. So if you go to a Disney resort, if you go to on a ride, if you have been in Orlando to Winnie and Arnold Palmer Children's and Women's Hospital, that was designed by Imagineers. I was really fortunate during my time at Walt Disney to be part of a team that brought to life a book, What If Disney Ran Your Hospital? Anybody read that in here yet? If you haven't, you need to read it. It's the concepts of why Disney should run healthcare. And people say, well, Disney's all about entertainment. I can tell you that Disney is a more highly regulated industry than healthcare is. Because you have to think that about 300,000 people a day just at Walt Disney World ride a ride. How many of you in the past couple of weeks saw the tragic news in Orlando, Florida, park there called Icon Park, where the 14-year-old boy plummeted to his death because someone went around quality and safety. The young man was a football player. He was 6'3" and weighed 340 pounds. I am 6'1" and weigh 320 pounds, and I know not to get on those rides because they're not made for that weight limit. But a ride operator surpassed safety and let that young man on. Highly, highly regulated industry. So what happens, my next step in my life takes me to this company. How many of you know this company? I was hired at Humana. And I was hired at Humana to focus on member experience and starting to put the human at the center of everything healthcare related. It's when it became really popular about 10 years ago. And then I was recruited to this organization, which is a higher ed university, where I was actually the first chief innovation officer in the country for a university, and it's David University in Cincinnati, Ohio. And it was to focus on non-traditional revenue streams. So, does that make a logical career path, right? Doesn't everyone do that? Well, that's kind of what I thought for a long time. Here goes to the story now. I want to introduce you to my family. Yes, we are still Disney buffs. To this day, that's my wife and I. That was in January of 2020, right before the pandemic. We were on a Star Wars cruise. Yes, I wear my Darth Vader shirt. She actually dressed up, yes. And then that's my wife and I up in the top left with our two children, Kayla and Colby. And then I am a huge Kentucky basketball fan. I tell everybody that. Let's not talk about this year's March Madness, what happened. And then again, there is Kayla and Colby walking on the beach in June of last year in Hawaii. And I want to bring to life Colby for you. There he is, my man Colby. He is 6.5, so 6 years old. He has childhood apraxia, autism, and just recently diagnosed with childhood epilepsy. So it seems like the world's against him to some people. And he was born 10 weeks early. And so he started out, he was actually born in Phoenix, Arizona. He weighed a little over 2.5 pounds. When I saw him when he was 10 days old for the first time, I could put him in the palm of my hand. So both of our children are adopted. And my daughter deals with so much of what you guys just talked about in the previous one. So I'm telling you from a patient side, a lot of what you need to hear. My daughter is 13. Went through severe mental anxiety, depression during the pandemic because she is an extrovert. And here she had to go to school at home. And he just degressed unbelievably to us. It was actually quite frightening for us. He's all boy. Things that Colby likes. The game Minecraft, if you know anything about that. Legos and blocks, and he loves Mickey Mouse. And when he grows up, he wants to be a rock star. He wants to be an engineer. I haven't figured out how he's going to be a rock star and an engineer at the same time, and a gamer. So I want you to remember Colby as we walk through what we call the experience ecosystem and why this is so important. Organizations are more than org charts, strategy documents, mission statements. They're living, breathing ecosystems filled with people, touch points, and systems. And I believe that in March of 2020, the healthcare industry got slapped upside the head and realized and I will boldly say this, I say it at many healthcare conferences that I speak at, that the healthcare system we realized in 2020 was totally built for one thing, and it was to pay claims and not take care of people. There's someone who worked for Humana, right? So an insurance company. All of a sudden, how do we handle all of these humans and what's going on? Do I think that we saw neurodiversity rise? You will also hear me say today, and I'm begging you as an industry, please quit calling it mental health. That stigma is incredibly hard to live with for people. And I do a ton of qualitative research, so I'm trained in ethnographic research. So the term neurodiverse is much more appealing because I am a neurodiverse advocate. Not only do I have 2 children, but I have adult ADHD. The pandemic, as a small business owner, I heard our dentist, as a small business owner, was the most stressful time in my life. I had to go on medication to help with my anxiety, to help with my depression. So, all of this comes to life. And I don't know if you can depict what's happening over there on the left, but it says, our silo mentality may be getting out of hand. And there's alligators swimming around the moat of people. How many agree in here that healthcare is siloed? So let's talk about the experience ecosystem, the web of people, touchpoints, and systems that combined to define the experiences of the people in the ecosystem. To leverage experience as a competitive advantage. And I'm going to ask you guys some questions here in a minute. One that increases engagement, loyalty, and revenue year after year requires aligning, engaging, and humanizing the entire ecosystem. That is the definition. We have trademarked this concept because during the pandemic, my business partner and I were out walking in February of last year, and we were talking about how do we get people to understand this? And one of the questions I get frequently is, how does Disney do it? Well, how does Disney have this incredible experience? How Disney does it, and many other organizations, is they actually align around an ecosystem approach. So what do you see in the very center of this ecosystem? There's people, right? We talk about being a patient-centric industry, and listen, 95% of my business is in healthcare. And I've worked in the industry. We talk about being patient-centric. We talk about being patient-centered care, human-centric. I call bullshit on that today, because we are not an industry that is patient-centric or human-centric in any way, fashion, or form as an industry. There are pockets, yes, but as an industry, we still don't have it together. So here's what an ecosystem might look like. Up on top, customer experience. Digital experience. Anyone work in IT in here? I know, right? Supply chain integration, leadership and culture, marketplace awareness, vendor relations, brand loyalty and messaging, and employee experience. How many organizations work in healthcare that all of these teams are siloed and don't necessarily work together? Right? What happens in Vegas stays in Vegas. So yeah, you can, right? That is not how you get a successful experience ecosystem. Now, I'll talk about just for a moment marketplace awareness. How many days in your life do you spend sitting in a meeting and within your organization with the same people talking about the same thing I see people in heads, right? Right? We as an industry also don't want to invite others into our industry, right? We don't want people out there. But let me say this to you. Let's take the banking industry, for example, and we have, from an IT perspective. Is it okay if 99.99% of the time your bank gets your deposits right? Well, why not? 100%, right? Why is 99.99% of the time not right? Okay. Trust? Process. Right? But yet we're still trying to figure out digital experience in the healthcare space when there's a whole industry that's figured out digital experience. Right? Banks get it right 100% of the time. And if they don't, what do? You call them, and they fix it. Any American Express people in here? Right? I love American Express. They won me over with their customer service. They could probably do something wrong financially, and I would still stay with them because I have a trust in them. And there's trust happening in these ecosystems. But this is all we need to remember, that when people are involved, things get messy, and it's time to rethink our approach. Reimagine our relationships and redesign our experiences within healthcare. Put humans at the middle of everything we do. And the result is this: a stronger organization whose people are able to make a profitable, sustainable impact on the world. So, we're going to do some shouting out here, because I want you to start thinking about you and your organization. What word do people typically use to describe your organization? You can say it out loud here. Friendly. Friendly? What I hear over here? Okay. What else? Integrated. Quality. And how do you know that people are saying this about your organization?
Because I'm right down there in the front with them.
You're down in the front with them.
The last 25 years.
Awesome. Because they post it. Surveys. HCAP surveys? CSAT surveys? What type of surveys? What type of surveys do you get in your organization? Is it for HCAP? Is it for CSAT? Or is it NPS? Or none of those letters.
I don't know what that means.
Great. That's actually good because I am a big believer in surveys for the right reasons. And I will tell you this from an experience standpoint. When is the last time you drove your car looking in the rearview mirror? Well, why not? That's what we do with surveys. We're always looking in the rearview mirror. We're not looking at what's happening today. That's always a fun thing to say at a marketing conference, right? Because so many people and organizations bet on Net Promoter Scores. Net Promoter Score is built to look in the rearview mirror, not what's happening today. So think about that from the human experience. The decision I make today on experience is all based off of probably what happens with my experience here on my cell phone. And when we start creating healthcare experiences that meet our expectations like we get on a cell phone, then we started to name it and get it right. And people are like, but you can't do that. We have people. Yes, you can. And those are organizations that do it. So, let me go to next question. Name a company with an amazing experience. Shout them out to me. Besides Disney.
Well, it's for short term, and I would say that probably after next 2 years, but Amazon.
Amazon?
Right now. 2
Okay.
years later, no. It'll be out.
Yeah. Amazon, who else? Great experience. Nordstrom. I don't like Nordstrom because they have a personal shopper and she calls my house frequently. And she says, Mrs. Neeson, we didn't put a box together that we're sending to you. Right? And that box shows up. And she goes, oh, look, a new dress, a new pair of shoes. Right? But it's a great experience. Nordstrom understands as well how to take care of families with special needs. So they, like the personal shopper aspect, they understand my wife has a son with autism. For her to go in shopping is stressful. Her husband's on the road 50 to 75% of the time. So it's great when the personal shopper puts stuff together, puts in a box, sends it. If she wants to keep it, great. If she doesn't, she sends it back. Stress out of it. How much more do you think we buy from Nordstrom's than we do from any place else? Right? Loyalty. This whole concept, you hear it right now in healthcare, personalization. Right? Hyper-personalization is what we've got to get to in healthcare. Not just personalization. Hyper-personalization. Go look that up, because that's a whole nother talk that we can have. But, all right, Nordstrom, Amazon. Anyone over here? Shady Rays. What is Shady Rays? Sunglasses. Okay? Had a great experience with them? Yeah. Yep. Great. And you'll always buy from them. Right? And if they raise your prices, does it matter? Yes, I love it. Okay, so let's talk about this, right? Now, you're talking to the man who, if you know anything and are friends with me, you know that my morning starts off with the Chick-fil-A Diet Coke 6 days a week, and God, I wish it could be 7 days a week, but I also understand as an organization why they close on Sunday, right? So, Chick-fil-A. How many like Chick-fil-A in here? Why do you go there?
They're super friendly and it's always delicious.
Super friendly, always delicious, excellent service, quality. Now, is it always at 100% of the time? So far, not always, but because of the trust factor again. And I will tell you a little bit, I was very fortunate to work with the Truitt family at Chick-fil-A on a project as well. They very much believe in the Disney way. They've implemented much of the Disney way. And I actually worked with them with one of our largest retailers in the country who is in the top 5, but I can't say their name, but they have a nice little spark. And we all worked together on a healthcare project. All right, so let me ask you this. Name a company with an absolute horrible experience. What? Spirit Airlines. Who's flown on them in the past couple weeks since they've canceled like 600 flights? Right? Yeah, I see a lot of talking about Spirit. Do we need to go to the bar now? Do we just need to stop? And like, if she's going through PTSD back here, we need some, right? So, Spirit Airlines. What else? Penske. Why? But they let you make a reservation for a truck. I'm a businessman. I spend 75% of my life on the road. What about rental car companies? Certain. So you find those and you hold on to those, right? Yeah. Healthcare. You know, we're still, after all the work for 10 years we've put in to becoming patient-centric, we're still barely above cable companies. Right? Huh? Cable companies. Yes. Right? Like, I'd rather just do that than deal with a cable company. Awful. All right. I'm trying to be very aware of time here, too. And anyone that wants any of this information, I am more than happy to send it to you. You need to start, as an organization, to look at this very simple diagram. High trust, low trust, transactional, relational. Where do you think you want to be on this? Up or right? How many companies is there do you know that you have high trust in and relational? Few. Right? Shouldn't healthcare be there? But where would you probably put healthcare? So I do think that there are people, typically bottom left, or I do think there are people that have a lot of trust in healthcare, but still very much move in it on a transactional basis. Yes. Yeah. Let me see what the next one, I may skip through these next ones. This one I can give you guys, that's just more on that. So, how might we strengthen our experience ecosystem together as an industry and as an organization? And I want to make sure that I left like 2 or 3 minutes here. Any questions about what I asked? I hate to make you come up here. It's small enough and we're all loud enough. I think you can say the question. But any questions on what I have touched points at today? Yeah. Yeah, so this is an interesting concept that I really wish we could figure out in healthcare, because if you go to other countries outside of the U.S., they've got this pretty well figured out in some way, fashion. I think the way we have to start blowing up silos is truly understanding what your consumer or your customer wants. That's when I still go back to saying, we remember our last interaction on our cell phones, right? All this is always a positive. Now, it's interesting to me, how many of you are Apple fans? How many of you have had all 12 Apple phones? Right, I have my collection, right? When you buy your Apple phone, do you know that it's not going to work 100% right? Right? So why do we do it? So it works more than the other ones, and we have high trust and high relations, right? That's why I have an iPad, a Mac Air, a Mac Pro, 2 Mac Pros that are just mine. My wife has one, and my daughter has one. Like we are an Apple store when you walk into our home. But it's because we have high trust in them, and if it's broken, they fix it. Right? They figured out actually how to take an ecosystem and bring everyone into their ecosystem and alleviate all silos, right? Why don't we just take our guard down in healthcare and invite a bunch of people to the table and say, let's fix this? I know it sounds really simple, but it really is that simple, and I don't understand why we don't. Yeah, another question, comment?
Do you
something that you can do with the current resources without actually increasing the financial burden?
So I'll make this with one simple, and the question was, do we think we can do healthcare reform without a financial daunting financially on the industry? I think we need some daunting financial things in the industry to wake us up. Prime example. Anyone know what Mark Cuban's doing these days? Do you know who Mark Cuban is? Billionaire, Shark Tank, owns the Dallas Mavericks. Launched a pharmacy company a month ago, took oncology drugs that used to cost $25,000 for a patient, put them on the market for $40. Do you not think the pharmacy industry is going, what the, right? I worked for an insurance company. I'll leave with this story here. A year ago, I had to have oral surgery done. So, it reminded me of my dentist. I walked in on the day of oral surgery, and they said it'll be $900 with your insurance. I said, great. I know healthcare. I stopped, and I said, but can you tell me something? Can you tell me what the cash-based price is? She said, well, absolutely, Mr. Nason, it's $500. I said, it's $500 for me to pay cash, or it's $900 for me to hand you my insurance card and the same credit card. Don't tell me we don't have a ton of administrative cost in the healthcare system that needs to be taken away. I've studied the industry, I've worked within the industry. We need a financial shakeup, and the money needs to go to where it needs to go. And yes, we need to do research. I'm not saying all those things, but there's a lot of wasted money in our system today. So, I know if we were going to break, I would be happy. I've got cards to talk to you guys before we finish. But thank you all, and we'll see you later.
All right. Round of applause. John, once again, please. Thank you, sir. I say we take a bit of a moment to kind of let everything soak in and do a little bit of networking with our colleagues and whatnot. Take a short tea break, as they're calling it. We'll call it a coffee break or a Coke break or Sprite break, whichever you like. That's out that door to your right there. And while you're hanging out with your colleagues and snapping photos and whatnot and posting them to your Instagram and Facebook and those social media platforms, please hashtag it Health2Conf. Once again, that's Health2Conf, C-O-N-F. And we'll meet back here in about 30 minutes. All right? Enjoy yourselves.
Till we have to go back in.
Being back at the office, I haven't 30 minutes for lunch.
I hate it.
Vivian? What? No, Vivian.
If you're not back at your desk in 10 minutes, you're fired. Do you guys ever dream about quitting?
I wish we could quit.
Why can't we?
We could do our own thing.
Yeah, like start our own company.
Be our own bosses.
We could get our weekends back.
I could wear sweatpants every day. Bridget.
Bridget! Let's quit! idea. One amazing idea.
I got donuts! God, I hate how they always double bag everything.
Brian, what did you just say?
I got donuts.
No, about the bag, the double bag. Oh my God, Brian, you're a genius.
Thanks, I just got a selection.
No, the bag.
Oh, I still don't get it.
You know that 87% of stores double bag?
One reinforced bag could be as strong as two regular ones.
And better for the environment.
And better for the budget.
Yes!
It's just like...
This is so exciting, guys! Let's meet tomorrow. Yeah, but where? We don't...
get a tea break and are caffeinated the rest of the afternoon here. We've got some good stuff still to come. Healthcare providers will find the next session actually extremely useful. A strong patient-provider relationship leads to better outcomes and also enhances transparency. To map out its concrete benefits, we have with us today Dr. Nidhi Seth, founder and CEO of NeuroBloom Physical Therapy and Wellness, PC. The topic she will speak on is personalized healthcare, a new approach to bring back emphasis on relationship-based care, leveraging technology and individual connection in the COVID-19 era. Say that 10 times fast. Let's page.
Hello. Hello, everybody. Good afternoon. How are you all today? Thank you all for coming back. I know this is a little refreshment break time, but I really appreciate you all coming back in here and join me in discussing how we can focus more on personalized healthcare and really work together on trying to bring back this emphasis on relationship-based care to leverage and use technology as well as individual connection in this new era that we now live in, which is the COVID-19 era in this pandemic. So as we talk about relationship-based care, there is this quote which I very much relate to with the concept and the approach that I started NeuroBloom, the company of physical therapy and wellness, with. What we are trying to strive here with NeuroBloom Physical Therapy and Wellness is to have and create a wholesome experience for our patients in the moment, where we're focusing more on the human being connection with each other, the provider and patient connection with each other. We are trying to bring together this connection in this COVID-19 era where the care is more conveyed through touch, through a kind act, listening to our patients, having that individual connection, forming a relationship, and trying to understand the experience that they are going through so that we can create a wholesome healing experience for our patients. And this very beautiful quote that was written by Mary, and this is exactly something that we're trying to encourage here in the company with NeuroBloom and what we're trying to strive and bring it out all together. What are our needs for today as we speak for bringing this relationship-based care? Why is this so important? Why do we need today? And why do we need to redefine, reimagine this concept of bringing in the healthcare system? With the unprecedented changes that has taken place with COVID-19, it is extremely important that we revisit, revise, and come together to reimagine what a patient-provider relationship and what that visit should be like. It could be through virtual care, it could be through digital check-ins, it could be through in-person care, be it in the form of concierge physical therapy, which is what NeuroBloom Physical Therapy has now started with, this whole concept based on providing and taking this care to a new level, providing door-to-door care to our patients, trying to cater their needs as to what they need, when they need, especially given in this environment where we had a shutdown with the government where our patients did not have access to the gyms, to the traditional methods of having access to clinics and departments and outpatient departments and having access to coming and seeing the providers at these traditional methods and models of healthcare system. So how can we provide this care better to them? How can we take it to them? Through concierge physical therapy and through telehealth physical therapy, this is one of the ways where we can try to redefine this relationship-based care, where we're shifting this transactional model and bringing it to a whole new level of redefining the relationship-based care. Now, when I say what are our needs for today and what is this relationship-based care, this is how This is how I look at it. This is how I envision for NeuroBloom Physical Therapy. This is how our team envisions. This is what our perspective is. To reimagine what this visit should feel like, to bring in the current opportunity and focus more on not having so much emphasis on volume metrics or documentation requirements, or what should it be for how much do we need to get reimbursed, or how many patients do I need to see in an hour, or how much can I do so that I can move on to my next patient. We're trying to create a relationship-based care, which can be bi-directional, multi-directional, creating an empathetic response, fulfilling this relationship, facilitating health and well-being in the true manner. These are the 4 fundamental roots of relationship-based care, which NeuroBloom feels are the whole heart and soul of creating this holistic experience as to why we need to place more emphasis on this relationship-based care. Starting with people-based care. What is people-based care? Why should we focus on this? Taking the time for people-based care to review the pre-assessment process, the intake process, taking the time to review our patient information before they even come and see it. So at NeuroBloom, when I'm seeing patients, when they're coming to see me at their initial session, I already have a history from them beforehand. The team connects to get the history, to get what they need, what their needs are, providing initial consultation care, phone calls, understanding what that visit is going to be, giving them the opportunity to have questions ready for me, to have their concerns for me that they can come and discuss with me during their initial session. Trying to create this healthcare system and focusing more on people-based care versus trying to make it one-directional. As we talk about making it bi-directional, trying to have people connection, provider connection, and making sure we're engaging together to focusing strengths and needs and what their past experiences and their failures have been, taking that into consideration and designing their care plan, which we call as the NeuroBloom Care Plan, a complete holistic NeuroBloom care pathways, trying to take these into consideration versus the traditional model of healthcare providers, where the providers have great skills, they have great knowledge, they're great problem solvers to treat their patients. But starting that care off with focusing more on the patient's strengths, their life journey, their experience, because they know more about their diagnosis. They know more about their life, their experiences, what they're going through, their diagnoses. So having that ear to their problems and just focusing more on what they are here for and creating that wholesome experience of provider and patient relationship, such that we are striving here every time they come to see us to make a full experience for them and target on each and every need. When we talk about the holistic care with holistic focus with integrative care, for example, I have patients where I'm treating where They talk to me about a particular diagnosis that they're coming to see me for, a stroke, multiple sclerosis, tumors, cancers, whatever their diagnosis is. Here's what we're trying to do at NeuroBloom. Not only treat them for what their diagnosis is, but providing them that complete round care all the time through digital check-ins, making sure that we are following up with their care, pre and post assessments and evaluations and treatments, following up through available for them when they need us through text messaging, using that digital care, especially in the COVID-19 era, where we do see that patients have access to urgent cares and ERs for medical needs, but not for physical therapy. What if they need to reach a physical therapist for their ongoing care and being able to reach us using digital platform and using digital technology to reach us when they need to? Having those wellness classes that also NeuroBloom teaches, which is an addendum which creates like a following and a maintenance therapy that goes on, even when they get discharged from their actual concierge physical therapy, where we're focusing on integrating their complete health and wellness by maintaining their balance, their mobility, and if they want to see us for any of their continued care of vestibular issues, weight loss, post-procedures, wellness issues, and fitness issues, where they want to focus more on decreasing falls in the community, becoming more safe in the community, and having that independent life. So we can take them, we can carry over whatever they learned in their physical therapy and transfer it to their community, into their functional life, so we can help them become more independent in their activities of daily living, like shower, bathing, dressing, making sure that they're able to tie their shoes, wear socks, dress their upper body, dress their lower body, being able to cook, being able to become independent again in the kitchen, in the garage, where they need to be. Helping them carry over those learned skills from that environment that they learn in physical therapy and taking it into their concierge care and telehealth care and taking it into the environment where they can now become independent with instrumentals of daily living, which we call as IADLs, where we can help them become more independent in the community, in the grocery stores, return to sports if they need to get back to certain activities that they desire to, get back to work, get back to life. Because that is what physical therapy does, and it strives for the profession as a whole. And what we're doing in NeuroBloom is taking that concept to a step ahead, to a new level of providing that care and encouraging that care through being available for our patients and creating that personal relationship with our patients, to have that provider-patient-clinician relationship at all the time. However, there's always a but. However, realistically, as we talk about what the relationship-based care is, what our vision, what our mission is, what we are striving to be at NeuroBloom, these are some of the examples, some of the very few examples that we see, which are unfortunately some of the barriers to the growth that we see in our ongoing traditional healthcare model in our system that we see, where we talk about our clinicians are the experts, our patients are expected to be compliant to what the procedure is, to what the definition is that's given, to what the treatment plan that is designed for them. We have to follow the electronic health records and electronic medical system records. We have insurance industry. We have third-party people where we're trying to bring all this clinical level and clinician level together. We're trying to maintain that provider care together. However, what we're seeing is a lot of increased time which is spent on these documentation systems, leading to higher burnout rates in the providers. We're seeing sometimes that a lot of use of a technology with respect to the digital care and the digital platform. And we're also seeing that together, are we spending too much time? Are we having to put in together all this work, all these efforts to get reimbursed? Are we having to limit the number of patients that we're seeing to follow a certain system that's pre-written? And is that compromising our patient care? Is that compromising our quality? Is that high burnout rate that the providers are facing today, is that shifting their focus from seeing the patients and creating that whole experience for them? Is it leading to a shift of their focus on counting the number of patients or having that volume of patients that they can see in 15 minutes or 20 minutes? Are they being burdened to meet the productivity requirements of the hospital settings or of the documentation system settings, of the health record system settings, of the insurance industry? Are we all being burdened by that? Yes. And that is what we definitely see as some of the very barriers to the growth that we are very pronounced, that we're definitely seeing with our healthcare system today. However, there came a pandemic. We're very much in the middle of it right now as we speak. That's what it took. It took a pandemic to reflect on this practice. I still remember the day we had this news started coming out about there's a virus, there's COVID, there's this coming out, it's going to be a pandemic. Things started changing. And before we knew, this whole healthcare system was about telehealth, telerehab, telemedicine. We cannot go to the doctor's office. We have to wear masks. It's dangerous. It is not safe. Everything changed overnight. More focus, more transformations. Everything started changing. The communication system started changing. The healthcare system started changing to meet these unprecedented changes. And we're still very much in the middle of these constant changes in the healthcare system. Using these digital methods to transform these human connections is what we want to try and use to optimize these visits. It can be taken as a pandemic that destabilized the economy. The pandemic changed the way we're looking at our healthcare system, where we're not able to focus and we're not able to keep that patient-provider relationship. However, the way NeuroBloom looks at it is that this is an opportunity that we took when the concept was created to start the company. This is the time, we thought this is the time for growth. This is the time for innovation. Bring changes in the healthcare. By making these digital transformation, by using these digital methods to transform human connection, to optimize the clinician visits, to take the level of care to provide them to a concierge level, take it to them, see where they need to be, have that constant connection through using the digital visits, having follow-up e-visits, work with them, treat them where they need to be to make them more independent and safe in their community. So what if they're not able to come to us or our providers at our clinics, at patient departments? But we can go to them. We can go ahead and create this growth. We can go ahead and bring this innovation. We can go ahead and use these methods to bring this evolution from points of care to touches of care, where we can change and bring this change. What I exactly mean by bringing this technology integration for patient care, and I have as defined by the digital physical therapy practice task and the definition as it says out there, it could be anything. It could be through digital communication services. It could be through those devices. It could be anything like e-visits, virtual check-ins, text messaging, follow-ups, providing a available to your patients when they need you, when you are there. Trying to bring this practice of immediate needs, addressing those urgent needs and those concerns in the practice of physical therapy, like it has been there and it is there for patients when they need them, from a medical standpoint to go to the urgent cares and ERs. And so what we're trying to bring in here in the concept of physical therapy is using that digital form and using that concierge care to become the urgent care for physical therapy, to be available for our patients, to be available to provide them the care that they deserve, they need. And absolutely, yes, everything that I say, everything we strive to become, we do consider that there is always opportunity. These are the main seeds of growth that we look at, where we talked about how they're testing us, these opportunities to bring us for growth and innovation, and ultimately changing the traditional model of office-based care amidst these outbreaks, and using this opportunity to have lower provider burnout rates and to bring this current state of financial and economical destabilizing economy that we see by using this and bringing it to their and bringing it to their level. What do we envision at NeuroBloom Physical Therapy? What is our mission? Just some of the pointers there, just to give an idea, but it goes way beyond this. It goes way beyond what we're striving here to do. We're here all together to become and to provide the direct, readily available access to in-person and digital forms of physical therapy, creating that environment, creating that live and real-time experience with our patients, to be able to connect with them and to be able to have that direct care and that immediate care when they need, and not for them to having to wait for months, weeks, days to see us, where they need to come in a traditional office-based clinics, outpatient department, or inpatient department settings, where they can see us, where we can be available for them when they need us to be. And this is what we're striving to be. This is where our vision is. This is what we're really working towards, to re-envision the concept of physical therapy and integrate this care by utilizing technology and by utilizing an inclusive of all the care that we can provide through concierge, where we can try and treat our patients when they need us, where they want us to be, at real-time experience, real-time settings, and this is where we are striving to be at this time. NeuroBloom is one of the ways to reach and to revisit and to reimagine, to redefine that concept of what do we need for initial assessment when our patient first comes to us, and how can we make this experience of our patient as a complete experience of the care they deserve, they need, and when they need it. And this is what we're striving to be at NeuroBloom Physical Therapy and Wellness, by also taking the wellness classes, the fitness classes, integrating all of that together to provide them that continued care that they deserve, to provide them the continued well-being and continuous, and there's a continuity of the care and the treatment sessions, so they don't feel that they're done or left out from physical therapy. Here we are providing them that care, and this is what we strive to be at NeuroBloom Physical Therapy and Wellness. Thank you all very much. This is the best way to contact us if you have any questions or concerns. If you'd like to learn more about us, please contact us at our website at neurobloomt.com. One of the best ways to reach us for any more information that you'd like about us and what we're doing and how we're striving to be where we are today and what we strive to be in the industry of healthcare is at one of the best ways to reach us through our phone, 315-447-4590. And we're based off in San Jose, California. And our plan is to surely expand and take it beyond the state of California and be available to our patients where they need us, when they need us. Thank you all very much for being so patient. Thank you. Any questions from anybody? I'm not sure where we are on the time, so. Okay, all right. Well, thank you all very much. If any questions, please reach out. Thank you.
All right, thank you so much, Dr. Seth. One more time for her. All right. Moving on, the basic problem in our healthcare system today is a sick care system that prioritizes urgent treatment and disease management instead of focusing on its prevention. The next session is all about bringing about a revolution in this particular area. It is titled Sick Care or Health Care, How Your Health Philosophy Is. To understand this in great detail, please welcome on stage Ali Karausaba, who is the co-founder and CMO of sick.org. Please welcome him to stage.
Thank you, everyone. It's the last talk of the day. I make sure I make it fast and entertaining. My name is Ali Kazaizadeh. I'm a primary care physician. I'm internist. Also co-founder of the company called sick.org. And the reason actually we came with this name was we thought in this country we don't have healthcare. And we have a sick care, so when you're sick, you go to the doctor. So we have this app called Sick App. So when you're sick, you don't need to think what app should you go. You just go to the Sick App, and you actually click on the bottom to be seen for whatever reason you want to see. But here I want to focus on what's your health philosophy and why that matters so much. Actually, your health philosophy is the #1 predictor of success when it comes to your health. So every decision you make today, you can actually pass on the better gene, to the next generation. Couple of things I wanted to discuss here. So you probably learned something when you leave here, and how we die at the chromosome level. And also, what is the gene expression, and what is the telomere? If you know what is the chromosome, we have 46 chromosomes. Half of that come from your mom, half of that come from your dad. And when I went to medical school, we all thought, we're doing with whatever chromosome we get from your mom and dad. But we learned in the last, 10 years last 10 years, a group of scientists came with this idea of gene expression. And it is, if you do all the good things, you can bring to the surface all the good genes. And if you do the bad things, all the bad come to the surface. The way we die at the chromosome level, it's the shortening of your telomere. Any chromosome has this telomere at the end that as we age, the telomere becomes shorter, and we die. So it's if I want to tell you, it's like the shoelace we have is a plastic at the end of the shoelace. If the plastic becomes shorter, what happened? Your shoelace become unravel and you have to throw it away. It's the same thing happened to our human body, right? So is there anything we can do to make that telomere longer, or we can reduce the speed of the shortening of the telomere? Yes, we can. All the good things, I'm going to explain that. And as I said, on top of each chromosome, we have 1,000 genes. So if you do all the good genes, you can bring up the surface all the 500 good ones. If you do the bad things, all the bad genes going to come to the surface, and you can actually pass it to the next generation. So if we know what to eat, how much to eat, what toxin to avoid, if we know how much to exercise, if we know when to exercise, if we know how to manage our stress, and if we know how to have a better relationship and have a good time sleeping, these are the things you can do to actually, elongate your telomere. If anybody knows Dr. Ornish, Dean Ornish, so this is the research for Dr. Dean Ornish. 25 years of research showed if we do all of those, and I'm going to explain how we can do that, we can actually elongate the telomere by 15 to 20% in 6 months if we do all the good things. Eat well means what? Means you move from animal-based protein to plant-based protein. I'm not saying completely go, vegetarian. You can choose 1 or 2 days a week, just not to eat animal-based protein. The second one, move more, means exercise, right? Exercise every day. Anybody, can you show me a hand? Who exercise every day, every single day? Perfect. 3, 4, 5 people, right? Who 5, 6? But who brush every day? Who brush teeth every day? Every day, every single, right? So that's the same logic. The reason you brush every day is what? Because of your, right? The same reason you need to exercise every day, half an hour. If you can't go to the gym, I'll take half an hour walk. Just half an hour walk is better than nothing, right? Stress less. I'm not saying don't have stress. I'm saying manage your stress. How most people manage their stress? How most people manage their stresses? They don't actually, right? So they eat more, alcohol, drug, right? So that's how most people manage their stress. But the way you're supposed to manage your stress is meditation, relaxation, exercise, yoga, see your therapist, right? One of the best way to manage your stress if you don't know how to do it. And love more. If you have a better relationship, you make all better decisions in your life. If you have a bad relationship in your life, so you make all those bad decisions. So you better have a better relationship or learn to have a better relationship with people around you, including your loved one. Sleep well. And other things can actually, and it's different for people, from 5 hours to 8 hours for different people. But if you follow all those 5, you can actually stay healthier and longer. And I bet you in 10 years, we're going to have cure for majority of the diseases we know. But if you just stay healthier for the next 10 years, so you can actually stay healthier way longer. So you have a choice and you have a decision to make. So you make a better decision today and one tomorrow, right? Because with the better decision, you can pass the better gene, down the road. But can your health philosophy hurt you? The answer is yes, but also it can hurt you and your family and your community, and also it can hurt the next generation. Our healthcare system design and focus on treating diseases and sick care. The truth is our healthcare system designed around 1900. And that was the time we had a lot of pneumonia and the flu and a lot of injured people. So the way we have to deliver the vaccine and antibiotic and other care was the doctors and nurses we had back then. So, but we are living in a different world, and we can do much, much better. But is there a different road or something different we can do? Absolutely. I mean, in the United States, we have the best sick care in the world, right? So, but we need to focus on something else, well care. That's something that, as a primary care physician, if I can just teach my patient, just those 4 or 5 things, right? And it's a simple stuff, no-brainer. The problem is no-brainer is not, known for people. So, what insider know about our healthcare system that the rest of us need to learn? There was an article in Time magazine a while ago. So they interviewed a lot of physicians in the hospital, and the question was, what scares you the most? Anybody knows what's the answer? Being a patient. Being a patient scares us the most because we know what's going on in the hospital. So, really, in order to stay healthy, do we need health insurance? We really don't need health insurance to stay healthy, right? To stay healthy, all you need to do, those 4 or 5 things that we mentioned. Health insurance is I'm not sure what type of name is that, but technically it's a sick insurance, because when you're sick, you want to go to see a doctor, right? So the greatest doctor in the world lives right inside you. Your body is extremely intelligent, and your body knows how to heal. So, most of my patients come and they have a bunch of, vitamins, multivitamins they're taking for no good reason, and they ask me, so which one is good? I mean, my answer is none of them. If you can eat fruit and vegetable and variety of the food, so you don't need really multivitamins, unless some of your vitamins, when we measure, is low, then we might, replace your vitamin D maybe, or B12, and that's all we need. But the rest, really, you don't need to take multivitamin for healthy people. So USA has the best sick care system in the world. We have the best doctors, the best nurses, hospitals, academic health centers, the best health education, drug, and we are leader in the research. But our healthcare delivery system is one of the worst among the first world countries. Some argue that, it's personal responsibility to, avoid preventive diseases like diabetes or high blood pressure or obesity. So I'm all for personal responsibility. I guess no one can argue that. But also, I believe in government responsibility. I mean, advertising for junk food in the last 2-3 years was, to the roof. And I guess government need to provide some information to people and some regulation to avoid that type of advertising. The way it goes, if you look at the cost of healthcare, is $4 trillion. The whole GDP of United States is 23. Means 18%, 18% of the whole money of the whole economy, United States economy, goes to the healthcare, and half of that is waste. And from the other half, 80% go to treat of the chronic diseases like diabetes, hypertension, obesity, high blood pressure. So those are the things we can avoid with just lifestyle modification. So the question is, can we prescribe, as a primary care physician, can we prescribe a lifestyle medication as a prescription? And the answer is yes. And recently, Medicare started paying for that. And that was, all help of Dr. Ornish that pushed through that, research, for 25 years. Dr. Ornish was actually a cardiologist, and he was the cardiologist of President Clinton. And when President Clinton had heart attack and they put a stent, started like eating burger, right after that, and 6 months, 7 months after that, he had another episode of blockage in the heart. So after Dr. Ornish sort of taught him to eat better, sort of everything got resolved. And since then, he had no other heart attack. So changing the system requires recognition of a few things. One is the culture. Again, can we do more telemedicine, or can we do transfer the point of care from doctor's office to the people home, or can we do some data donation? Yes. The technology, how the technology can actually improve the healthcare. And why so far healthcare industry is not disrupted the way, for example, transportation or housing disrupted. If you look at the Uber is a communication platform, so simple. People can go into it and they can navigate without any training, right? So it's a lightweight software. So eventually, a lightweight software that has all the patient information and is patient-centric, not insurance-centric, not hospital-centric, not doctor-centric. Eventually, that type of technology can disrupt the healthcare. So if somebody wanted to disrupt the healthcare, you can reverse engineer that type of technology. Better medical education. We need to focus on prevention than treating diseases. Better health policy. Regarding reducing some of those regulations so we can actually move toward better prevention. Better reimbursement system. Half of the time that we see the patient, we barely get paid for it. And also communication. We actually at the SICK organization, we're committed to do whatever it takes to disrupt the healthcare, in a good way. And at SICK organization, we have this unique position to be able to help our patient and our community. So let's build a system for well care, and let's make that system available to everyone with the help of technology and innovation. Thank you, everyone, for listening. Thank you, and I have 8 minutes for questions, so go ahead.
So I have 2 questions. My name is Reginald Mbarke. I'm in the telehealth field, mobile health technology field. I take a lot of vitamins. And, I'm in my mid-40s. I take ginger, turmeric, those little garlic pills, zinc, obviously COVID, and vitamin D. And sometimes I mix those two with the multivite, right? So you're saying that's not necessary in my mid-40s, that I should be trying to eat garlic every day, trying to find something with turmeric in it, or trying to find something with ginger in it, or, that's question number 1. Question number 2 is, you talk about Uber and disrupting healthcare in a good way, the way Uber, and in a simple way. Any idea of an example of what that could be?
Sure. Thank you. So the first one, I do evidence-based medicine, and I have to go with those, evidence that we have. There's an article in New England Journal of Medicine, and next year went to Cleveland Clinic Journal of Medicine. The question was, is that okay for healthy people to take vitamins? The answer was no. And then, why not? Because it might hurt you, right? So, do we have any double-blind, random study to see if all of this multivitamin that we're taking, it's helping you or hurting you? We don't, right? And I'm not sure if you know about the Framingham study. 100,000 population, we put them on high-dose vitamin E, and this was a while ago, 20 years ago. So we thought two things can help women. One is high-dose vitamin E, and two was hormone replacement therapy. And this was 100,000 population in the city of Framingham, north of New York. And after 10 years, what we learned was those people, we gave them higher dose of vitamin E, they actually had more cancer and had more heart attack. So we have to call all of those patients that we put them on a high dose and ask them to, don't take your vitamin E. So we burden once in that study, Framingham study. So everything you do, you need to know what is this risk, what is the benefit, right? So in this case, I guess the risk was way more. And the absorption of the multivitamin is less than 1%. So you put your kidney and the liver in more work to metabolize all of those chemicals and get rid of 99.8% of that in order to absorb 0.2%. That's not healthy. And the second one, you said how technology can improve. Something called Uberification of the healthcare or democratization of the healthcare, right? So how can we make a visit almost free or accessible to people? I mean, almost everybody has a smartphone, right? So what we started doing at our own organization was, so come and see us through our platform. So if you have insurance, we'll take it. If you have insurance, we don't accept it, we'll still take it, we just charge you copay. If you have no insurance and government pay for it, like a CARE Act for COVID related, we'll take it. And if you have no insurance, and if government not paying for that, we still take you. We give you 2 free visits to see us, right? So even if you have a copay of $20 or $30, we might be able to help you through that copay and see you and take care of your problem right now. The reason most people don't go to see their own physician, even they have insurance, is because some people have high deductible and a copay, so they're not sure. If you go to the doctor, so they have to pay $200, $300 down the road. But if I educate my patient that for annual physical, even your deductible is $10,000, it doesn't go through deductible, right? If I see you for screening for depression, screening for obesity, screening for high blood pressure, still it's going to be a free visit. So how can I do more of that free visit to my patient in order to prevent things, right? So.
I have a question regarding prevention, which I subscribe a lot to, and I commend you for actually talking about that. But let's look at the real world, especially in the United States. We have, I think, 45% people obese, and yet the education now is actually trending towards not criticizing obese people, and regarding that as sort of discrimination, and it's actually now integrated into the culture as being obese is not being wrong and not being ugly. It's actually nice, acceptable, and so on. So what do you think about that?
So yes, in the last 60 years, so the rate of obesity went up from 15% to today is 75%. So 75% of the country is overweight or obese, right? And it's a disease, has an ICD-10 attached to it. And then when it become morbid obese, actually it's going to be the more problem, because then you're gonna put you on more risk of heart attack, stroke, and other stuff. I guess our dentist colleague, they did a much better job, because everybody at least, brush once or twice a week, but not everybody exercise once or twice, a week. So how can we actually help our patient to lose more weight? Is to education, right? But the reimbursement system is, I get paid for visit. I don't get paid for performance, right? So if I don't do anything, if my patient being more obese, and I don't do anything, at some point they have diabetes, high blood pressure, cholesterol, and then I can see them once every 3 months, and that's how I get paid. That's unfortunate, but that's the way it is. Need to be changed. Yes, sir. I have 1 more minute.
Yep. I'm Dr. Shintani from Hawaii. I started our integrative medicine clinic at our medical school. My question is this. In dealing with our healthcare system, one of the problems is the cost, and the elephant in the room is how the drug companies are really escalating the costs. For example, you talk about obesity. They just recently approved a drug for obesity, but when you find out what it costs, it's $1,600 a month, and the copay is still, now actually insurance won't cover it. So how do we deal with the escalating costs of medication? Even insulin is unaffordable for some people, and they need it for life.
I guess to stay healthy, you don't need medication. In order to lose weight, you better eat enough not to die. Small portion. Our brain designed to eat way more, evolutionary. We're not hungry, but we keep eating extra 30 minutes because our brain, designed for...
But some people need medication, like insulin, for example. If you have type 1 diabetes, no amount of dieting is going to prevent the need for things like insulin. Or if you have cancer, for example, there are many cancer drugs. What do you do about that? Because to me, that's what's breaking the bank in terms of our healthcare system. And then you can't pay the doctors because you're paying the drug companies.
I have no solution for that. I guess, it's a work in progress. Can I bring the cost of, medicine lower? Somehow, yes, I can, through GoodRx or some other, organization, but I have no solution for that. Thank you, everyone. I guess it's my time, and thanks to everybody for listening.
A lot of really great ideas there. Thanks again, Ali. One more hand for him. All right, moving forward, it's now time to honor the individuals and organizations who have contributed to enhancing the quality of healthcare services in their region. To help present the awards, I would like to call to the stage Mr. Sean Nason. Go ahead and give a hand for him as well. And as you hear your name, you're more than welcome to step up on this side of the stage and then exit on this side. Just kind of keep things flowing a little bit. U.S. Next up, Nothing But Hemp. Sick, S-I-C-K. Tosk, Inc. View Minds. Moving on to our Outstanding Leadership Awards, Alex Yarligian. Alexander Argilian. Brian Petit. Chris Varpay. David T. Newman.
So I just wanted to say that I'm grateful for the acknowledgement, the recognition. Thank you very much. I have to thank my team as well and my family for the advice, support, and to be true to the vision. So thank you.
Dean McElwain.
Kreitenberg. Evelyn M. Gray.
I want to thank the Health 2.0 conference team leaders for this recognition in my field of expertise in productivity and stress management. So remember, if you can't find it in 30 seconds, it's in the wrong place.
John Shiner. Mike Toder. Natanya Wachto. Palav Saxena. Shanthi Razu. Raju. Todd Shatkin.
I just want to thank the entire management team here at Conference Health 2.0 leadership for presenting this award to me, and I also would like to thank my team at Shatkin First, which is a mini dental implant company in Buffalo, New York, along with my wife Leslie and my 3 children, Jared, Juliet, and Jade, for their unwavering support. Thank you very much.
Tracy Boss.
Fox Marketing. To self. Mark Edwards. Mendy Edmani. All right, that'll do it. I want to thank Mr. Sean Nason once again. Please give it up for him, probably with the awards this afternoon. And on behalf of the Health 2.0 conference team and everyone present here, a big, huge congratulations to all the leaders who have been honored with these awards. Let's give all those people a hand as well. Ladies and gentlemen, it's time to draw the curtains on this particular day of Health 2.0. It's the first day of our conference. We'll be here for another couple of days as well. We really hope we've lived up to your expectations with our diverse agenda and networking events. You can expect a whole lot more coming up here in the days to come, tomorrow and the following day. Right now, I'd love to encourage you to follow us all just out those doors to your right, next door, for cocktail hour. I know you've all been waiting for that. It is Las Vegas. That's what we do here after a hard day's work. So we'd love to see you down there for a few drinks. Please join us and, give yourself an opportunity to talk to some of your delegates and, fellow health professionals as well. We'd love to see you over there. Thank you so much. Once again, my name is Brian Panarelli. Thanks for joining us today, and we will see you tomorrow.